Manager Lauren, welcome everybody. We will pick up where we left off.
Good afternoon. Today is Public Safety Day. We'll be starting on page 275 of your binders, and I'll turn it over to Rusty Leeds.
Thank you, Lorian.
Hi, Rusty.
Good afternoon, Chairman, Commissioners.
Glad to do it. Award winner. Award winning.
A little bit of housekeeping. We have cookies in the room that the fire chief
Okay.
claimed me credit for. So
Thank you. Thank you.
folks are hungry. There's a snack. So we have 2 hours allocated today. Some of these presentations will be fairly brief. There's a few decision packages that will be discussed. As we all know, compensation is the top priority, and we thank the commission for the work that you've done over the past couple of years toward providing better compensation for our employees. We have folks on pay plans. Corrections has staff on pay plans, which has helped improve their staffing and improve their capacity. EMS is on a pay plan, as you're aware. The fire district, toward the end of the year in November, you move to help 911, the dispatchers, the call takers, and supervisors to bring their pay up in order to try to help with staffing in that department. So compensation is very important. It still is. We still want to keep up with market. We still want to be competitive in our hiring and retention practices. As we say that, the reason there's some decision packages that, in addition to compensation, there does have to be some level of balance, and it's pretty tough. Work environment is also important. And some of these decision packages speak to work environment, which includes staffing levels, certain types of equipment that make it possible for our employees to get their jobs done efficiently and effectively and safely, for that matter. So it's hard to find that balance. You know that we've had a lot of decision packages that were submitted this year. Some of them made it into this discussion today, and some of them did not. After lengthy consideration and discussion through the budget team, we brought forth some for you to consider today, and I think you've been made aware of most of these, but you'll see them in a little while. Looking at staffing, I think we're a little better than we were last year. We have several greens, some yellows. Laura is a little better this week than she was a couple of weeks ago. She's started 11 new recruits in the academy who will be coming out here in a few weeks as call takers, and she's in the process of hiring and staffing another class as soon as that one's finished. Department of Corrections is showing 72%. They have some positions, and I won't get into it. Chris Morales is going to present for corrections today because Steve is out of town, and she may explain that if you have an interest. They have some positions that they probably are not going to fill, and they're using contracts to get that work done. So they're looking for innovative ways to get some things done, and so some of those positions are intentionally not held and will eventually come off the staffing table more than likely. So their staffing is a little better than what that appears, but they're doing much better based on their compensation and their ability to hire and keep some of the folks here recently. We'll move on to division strategies or strategic goals. These come straight out of the county's strategic goal. A lot of these speak to criminal justice system, CJCC type issues, the social change, mental health. Speaks to Tim's group too. The mental health, the social service support agencies that help public safety do the work that they do. There's a lot of things that really aren't in their wheelhouse, but they are first responders. They come upon these people first, and finding solutions to keep people out of jail, finding solutions to keep people out of ERs, finding them resources so they're not calling 911 and bringing first responders to their house when they don't really need that level of service are things that we're trying to work on. Legislation. A lot of these folks are plugged in with professional organizations. They have lobbyists that represent Department of Corrections, Fire Chiefs Association, and others. The EMS Association. They worked this in Topeka this year to get some legislation passed that improved their Medicaid reimbursements from the state. So there is work being done there. And we bring a lot of that back to you during legislative platform time. So these goals are being worked on. Additionally, the departments have goals that they work toward in order to provide the service that they do. Some of these speak directly to that, and some of these are more high level at the organizational level. But with that, we'll get into these right now. We're going to start off with Dr. Brinker in the office of the medical director. We'll have him present his budget, and then we'll move on through.
Thanks, Rusty.
Quicker.
Thanks. All right.
Good afternoon, Dr. Brinker.
Well, thank you. Thank you for having me. I'm Kevin Brinker with the medical director's office. Our budget will be pretty short. It's one of the shorter ones this afternoon, but let's get started. Basically, there's 3 of us at the medical director's office. We did add a position with Scott McBride as our credentialer. He's done quite an amazing job getting everything up and running and moving forward as we credential over somewhere between 950 and 1,000 first responders here in the county. Colonel Ruddle is my program manager. So our ultimate goal is to advance pre-hospital care here in Sedgwick County and making sure that the people that are providing it have the highest level of training and can actually practice what they've been trained to do. We have excellent providers out there that are doing an amazing and fantastic job. I also provide medical oversight. I review cases. I also respond to 911 calls in the county to assist paramedics in the field as well. We're maintaining and advancing the goals of the department and making sure that we're providing standard of care at the level of the national standards. And we are doing that here in Sedgwick County. There are some things that we can change, and we're looking into adding, including ultrasound and possibly the administration of blood product at one point. But those are processes that we're still working through. And then we're still working towards getting the SIM lab accredited with the national agencies that monitor that. Our 5-year challenges and goals, we're continuing to expand the Narcan program with allied officers. I think most of the agencies here in Sedgwick County are covered. We're looking at WSU and some other issues there. We're always reviewing protocol, and we're in the process of revamping that. And it's an ever-changing process with protocols to make sure that we're up to date and meeting the standard of care throughout the country. Along with that, it's going to be replacing and adding additional training equipment as those items that we have age and meet their lifespan and with new technologies that are out there. And then at some point, we may need to add an FTE, either a 1 or a half FTE to help Scott with maintaining the lab and preparing for training that we're planning. Basically, my budget is the highest percentage is personnel costs. There was an increase in 2024, basically at moving Scott from an MOU position from EMS to a full-time FTE within the medical director's office. And then the rest is basically cost of maintaining the building, commodities and that sort of thing. There's always a percentage upswing each year just due to the cost of doing business. And that's it in a nutshell. Basically, the decision packages were tabled for this year. So any questions?
Any questions? Go ahead.
No.
Doctor, thank you very much.
All right. Thank you all. I appreciate it.
I'm sorry. Oh, there's
I have one question.
I'm sorry.
I apologize. I'm a late thinker.
That's okay.
So, in the past, OMD has done credentialing, not just for Sedgwick County EMS, but Sedgwick County Fire,
Right.
and then also to other organizations in the community. Can you please talk, what's our relationship with WFD, for example? Are they relying on OMD for that now, or are they doing
Yes.
something different?
We're doing that. And we've also partnered with them to do the EMT programs for the recruits. When they do a recruit class, they're doing the EMT, well, at least for now, they're doing the EMT portion first, and those recruits that pass that, they're getting into the recruit class. So I'm the medical director for that as well. So we have a close partnership with them. We've also added Cheney Fire this year and all the other.
What about Mulvane and Derby?
We have Derby. We do not have Mulvane.
We invited them or they just, are they not
I
interested?
think they do all of theirs through Sumner County, but we can reach out to them. We've also have credentialed paramedics within the Derby system, so they're running ALS care as well. So if they have a patient that there may be a longer response time for EMS, they're able to do the same type 1 care, the ALS care that EMS provides.
That's a great answer to my question. I have one question for Lindsay. I'm just looking at the 23 adopted and then revised. It looks like we added that one the credentialing specialist in the
Right.
revised budget,
Mhm.
which added the salary component to that, but the revised in the book doesn't reflect that increase. On page 278.
And and Lorian can speak to this if she wants to, but that's the information on page 279, the personnel data actually comes over from one part of our system. That's our head count system. It basically pulls the positions. It doesn't necessarily reflect what's in the budget. At some point, a budget transfer will be necessary, and Dr. Brinker can speak to, I think you mentioned earlier about how the position transitioned. And so if you want to speak to that, then we can get into the details of the.
Well,
the
I think
budget
what you're
itself.
referring to, Scott's position originally was an MOU, it was a loan from EMS. It was an EMS funded position. But we've taken that over and added it to the OMB budget. So that's where that occurred. So, and then we work quite closely with Derby, John, Chief Turner and Lyle Price. And
I agree. I totally agree with the changes. I'm just looking at the maths. And
So
Sure.
the way we typically do this is when positions move like this, which is not often, is we will have the department deplete their personnel budget. And then we will move exactly as much as is needed later in the year to cover those personnel costs so that we don't.
the reason I bring it up is it looks like there's an increase requested, but reality is not, because the 23 revised on page 279, the numbers are exactly the same on 2024 requested budget. But if you go back to 278, it looks like there's a huge increase. In fact, on your summary page, it looks like there's a huge increase, but it's not really what
Right.
it's not as it appears on here. This is almost it requires an explanation to understand what just happened here.
certainly, and I apologize for that.
No, that's okay. Thank you. That's all my questions.
Yeah, and there's no apology needed for that. That's just a function of how our budget
I understand.
process works.
Okay.
So you're good.
Anything else?
The transfer of that position from EMS to OMD did appear on the agenda and was approved by the commission on consent agenda for a staffing table change at some point in the past. I don't remember when now, but.
And I totally agree with it. I think it's great. I just, the numbers on slide 8 or slide 8.
Yeah.
By itself, without explanation, that looks like there's a request of $108,000 increase, but it's not what it appears. Thank you.
All right. Thank you all. I appreciate it.
Okay, and we will follow that with Emergency Communications Director Laura Forshee.
And while Laura's coming to the podium, I just had a sidebar with Maureen. We'll get the transfer done mid-year, so you don't have to have the same explanation for the recommended budget.
Good afternoon, Laura.
Good afternoon. How are you guys?
Fine. How's your world?
Good. I printed off a million pieces of paper to bring with me, so I get my notes all in order.
Well, we don't have enough paper.
All right, Laura Forshee, I'm your Director of Emergency Communications, of course. Looking at our workforce. Doesn't look great, but it is getting better. We did have a class of 11 that started on Monday of last week, and we're really excited about bringing them in. So we're sitting at about 75% staffed overall. Of course, our biggest deficiency is in operations. We're at 72% staffed there. We also have one position that's open in administration. Unfortunately, that position is our hiring manager, and he's over training and quality assurance who left. And so we're definitely spread thin, but making the best of it and keeping things going. Looking at our strategic plan, our goals are, first of all, access to 911. The very most basic thing that we do is for people to be able to call for help when they need it. Second is collaboration. It's really important for us to work with our partner agencies to make sure that we are holistically looking at how to serve our community in times of need. And so, of course, that's our second goal there. Our third is retention. We know that our staff is really the most key component to making everything work. And so we want to make sure that we have staff that are happy in the job that they're doing, that they feel appreciated, and that they want to stay with Sedgwick County and continue to learn to do the best that they can within that role. And then the fourth goal is innovation. There's a lot of innovation available within emergency services and emergency communications with the amount of technology out there. And so again, just providing that access to 911 services in whatever ways possible, whether that's text to 911 or video messaging into 911, that innovation, and just making sure that we're hitting every base we can to have that equity and availability of service. So we've got some challenges and opportunities coming up. The first one is, of course, with our staffing. That's always in the forefront of our mind, and making sure we have enough staff to handle the needs of our community and our first responders. In 2021, we had 61 separations. Our turnover rate was 78.21%. Our typical turnover rate is around 48%. It is now down back to a more typical rate, but we're still not back to pre-2021 levels. The turnover rate within emergency services and emergency communications nationally, we're seeing a rise in that nationally, and it's always been one that's higher as we deal with the challenges of shift work and vicarious trauma and just all the fun challenges that go with emergency services. The industry standard for answering emergency calls is 90% of calls answered within 15 seconds. In 2022, we averaged 79% of emergency calls being answered within 15 seconds. I believe I've talked about this statistic every year that I presented budget. This is my 7th budget presentation, and this is continuing to be a goal that we are unable to meet that 90% within 15 seconds. A new challenge that has just popped up for us recently is that the FCC is now requiring radio encryption of transmissions of criminal justice information over radio channels. This is going to be applicable to all of our law enforcement users within Sedgwick County, and it was put into effect December of 2022 with a policy change from the FBI, and we expect to be held to this standard when we are audited in 2025. We have looked into some costs of that, and I'll kind of pause here and just discuss this because, again, this is new and evolving as of like 5 minutes ago before I walked in, of how much this cost is. So if you guys can recall, we just purchased new radios for all of our Sedgwick County agencies over the last 5 years. We did purchase radios that had single key encryption. And fortunately, that encryption is ADP encryption, which is proprietary to Motorola. Because it's proprietary to Motorola, it does not fit the FIPS standards of encryption that is required by the FCC and the FBI. So we would have to purchase new encryption for all of these radios. And what's just been discovered is that it's not just single key encryption. We would have multi-key encrypted radios because they need to be able to go across multiple law enforcement channels, which would all have their own encryption key. And that way they could be interoperable for each other. So for example, if the sheriff's office is responding out near Derby and Derby's going to assist on that call and Derby officers are going to switch over to the sheriff patrol channel, they would have to have both the encryption key of their home channel in it and then the sheriff channel in it. So we are, so that compounds the cost and the issue of it. The approximate cost that I've been given from Motorola is around $792 to do that multi-key encryption per radio. If we look at just Sedgwick County law enforcement radios, that's around 614 radios based on the numbers that we used when we replaced radios over the last 5 years. That doesn't take into account any new radios that have been purchased by agencies since then. And that is, again, just our Sedgwick County law enforcement partners. That would be the sheriff's office, corrections, because they provide criminal justice information over their channels, and courthouse police. And with the sheriff's office, that includes detention. So that cost is $486,324. And again, that's just a very ballpark figure for what it would cost to have this multi-key encryption capability in all of our radios. In talking about that, there's some discussion that needs to be had about whether or not corrections need single key or multi-key, same with detention. And so if they only need that single key encryption, it's only $550. The work is able to be done in-house by the radio shop. That is the one advantage we have, if you've purchased a encryption capable radio, which we did, then we can cut that over or flash that over in the radio shop versus having to send it into Motorola. So we don't have any of that cost and time without radios. One of the discussions being had right now with our 911 advisory board with our law enforcement partners is whether or not they would like us to pursue a grant that would cover potentially all of the law enforcement radios within Sedgwick County. I don't know, honestly, as we're looking at this price tag, that grant's going to be large enough to cover that. So I don't know that we will pursue that grant on behalf of all law enforcement, or if that's a grant that we will pursue just on behalf of Sedgwick County law enforcement. But that is one opportunity we have to cover that.
Hey, Laura.
Yes.
My question was going to be, since this is an FCC recent requirement, is there the funding opportunities? But you're saying the only funding opportunity will be this grant you just referenced?
The only funding opportunity that we have identified right now is a grant, and that grant was not designed for this specifically. Again, this information is quickly evolving, and new information is coming all the time. I know that that's a concern from law enforcement partners of it being an unfunded mandate. So I'm not sure if there's going to be other grants that are made available for that.
Laura, can you go for a timeline for commission as far as when this is being projected? So they have an expectation of.
Yes, so it is a standard now based off of this December 22 policy. The KBI who does our audits, so we get audited by the Kansas Bureau of Investigations, and then of course the FBI comes in and does an audit cycle. Our audit cycle for the FBI, we will be audited again in 2025. And so that is when they would audit to that standard. And if we did not meet that standard, we would not satisfy the audit. What the repercussions of that are, we don't know yet. And that's, again, part of the discussion that's ever evolving is, you know, so what if you don't meet the standard? What are they going to do with that? And I don't have an answer yet. Is that the timeline you were referring to?
I think, but it's so, I mean, I guess is there anything that commission can do with Senator Moran, or politically, is there anything we can do right now to have this discussion and talk about some common sense and reasonableness on timing in this? And if we're projecting ahead to August of 2025 as implementation, I don't know if we can make it, if we're going to have the funding to make it. I mean, is there anything that the commission can do to help you out on this?
Definitely. I mean, the FCC is the one that's coming up with this mandate, passing through the FBI with that. And so I would say that a conversation definitely would be in order of what I don't understand what the driving force of this mandate is, nor do I understand what the expected funding is for local municipalities. And so I think that's a fair question to ask. I know Sheriff Easter is also on top of this and watching it very closely and involved in those discussions. So I'm not sure if he has had discussions at that elected level that he could provide you information on. I'm not sure of that. But I do think, I mean, obviously the FCC is a appointed position at that federal level. And so I do think that conversation would be appropriate.
But if we need FCC to make a decision, we probably ought to be talking to Senator Marshall Moran and Congressman Estes and let them know what our issues are. So we need to decide whether or not that be the direction to go. And we need the manager to recommend that and draft a letter for us if that's the direction we need to go.
I will send you some information in writing of what we are being told, a copy of that policy, the timeline involved, the cost involved, so that you have all those components so that you may move forward as you would like as a board.
And this is applicable. It's applicable to all agencies, but Sedgwick County is licensed by the FCC to run your radio system, and you're the administrator of that system.
Correct. We hold all of our FCC licenses for our radio. The radio channels themselves belong to emergency communications. And so not falling into compliance with that, there's some discussion of whose ownership that is. And so, but we are the FCC licensure for those channels, correct?
May I ask a question?
Absolutely, you may.
The commissioner.
Yes.
So your final bullet on the public safety radio system going out of support, that was an exorbitant cost the last time we did that.
Yes.
And you are making a very good point that we need to think through how that looks. When is it appropriate to start having that conversation?
Now. And so, yeah, if we're ready to move on, absolutely, we can.
Sorry.
No, that's okay. No, that's okay. I've just, the encryption thing is so new. I wanted to let that settle in, but
Well,
no.
I think
so-
we'll put some money in contingency
Absolutely.
for you on that one for
Yes.
next year, just in case.
Okay. we will talk about the decision package for the radio consultant, which is going to speak directly to this issue. No, you're absolutely fine. But it's a very expensive system. It's a very large system with a lot of users on it, and we'll talk through what the components are of that system. But it is out of support in 2028. And what's interesting about that, or tricky about that, is that we bought our system from Cassidian. At the time was the vendor that we bought it through, and then it was sold to Vesta, which was then sold to Motorola. So we're on a Motorola system, but we do not have a Motorola core. And the core is like the heart of the system, kind of the major components. And so Motorola will not extend any support on a non-Motorola core system past 2028. They're well past the contract. We were thankful to have the foresight to write that maintenance agreement out very, very long. And so that we can't just renew that maintenance agreement. We will have to replace components of our system or go with a new vendor or something of that. And then we'll talk through that in that decision package. So looking at our costs, they are pretty flat. Some increases, of course, in personnel, as we've seen that increase in pay for staff, and some commodity increases as cost of doing business goes up. So going into those decision packages, radios is a major theme of them. And the first one is for the radio consoles at the 911 backup site. As you guys are aware, we are operating right now out of our backup site as we are renovating the main site. And so what we were thankful for was we had, of course, the planning period ahead of time to move everybody over to the backup site and to create a great operational plan for doing so. And moving that over and talking through what that was going to look like for our staff, for the public, for our public safety personnel, one of the gaps that we have, and we knew that this was a gap, but didn't feel it as acutely as we did this year, is that our radio system at the backup site is not a true console system like what we have at our main site. They are mobile radios, just like what would be in a police car or an ambulance that dispatch talks on. Because it's a mobile radio, some of the functionality of that is not the same as what we have at our main site. Some of the functionality that's very critical is the ability to simulcast calls across multiple channels or talk groups. So on the law enforcement side, especially if you've got an officer in trouble, a paramedic in trouble, a firefighter in trouble, an armed robbery, a rape, something like that, we simulcast that across all law enforcement channels. This becomes especially important in this cases where there's something going on in the core of Wichita, for example. I may have a deputy driving by there or a Park City officer driving by that location because they're transporting to the jail or they're coming down to the hospital for something. And without being able to simulcast that, they'll pass right by that instant without being able to stop to assist. The other part of it that we miss is the ability to have alert tones. Those alert tones are very key to keying field units into what's going on. So if you're talking with a citizen and you hear a warble tone, it lets you know that we've got a field unit that's in trouble, which is a very high priority situation. So those were the two pieces, especially that we were missing in that functionality. So as we were going to migrate over to the backup site, we had the forethought to just move our computers over. Like, why can't we just move our computers over, VPN back to the server at the main site and continue with that, which we were able to do. So right now we are operating on the console radio system that allows for that. But the detriment that we have is that once we move back into the main building, if we were to have a fire, tornado, whatever, anything really where we had to evacuate quickly, we can't just take those computers over and think we're going to plug back into the servers. There was a lot of legwork that went into that. So long story short, we were able to get a bid on that for $782,277 from Motorola. That is our radio vendor. And so it would be sole sourced through them. And that would provide that full functionality and redundancy at the backup site so that if we were needing to go over to there quickly, we would have that ability there. And talking through this with our 911 advisory board, which again is made up of our law enforcement, fire, and EMS personnel throughout the county, this was a high priority for them. They were very concerned about the potential of not having that while we were operating out of the backup site and the field unit safety issues that would come with that.
Laura,
Yes.
I fully understand what your issue is. What I am disappointed in is that we just built that facility a couple of years ago and moved into it, and it was always going to be our backup site. That was the plan from the get-go. And I don't know how we didn't come up with this as we were building that, what did we do wrong? That we didn't realize that we needed to have this functionality over there, because it's always been planned as a backup site. How did we get into this box? It's gonna cost us $750,000.
The discussions initially were where our return on investment was. This price tag is actually quite a bit cheaper than it was previously. It was around 1.5 million, if I remember, last time I put in a request for it. So the early discussions, again, when we were moving and transitioning over to that backup site from the old one, was whether or not there would be enough operations out of that backup site that we would have a return on investment for something with such a high price tag. The decision was made that no, it was not worth the return on investment, or the return on the investment was not there. I did put it in ARPA funds as a potential project, and it did not move forward. So because we did recognize as we started to use it, even for, one operational period where we're cleaning carpets, things like that, the loss of functionality was not one that we were comfortable with.
Can we use ARPA funds for this now?
When we put this in for analysis for ARPA, it was not determined to have enough of a connection. Now, that said, we've talked about revenue replacement. Once we do revenue replacement, we take expenses out of the general fund, put them into ARPA, and that frees up general fund cash. But I will say Alora has submitted this in her 911 tax fund, and there is adequate fund balance there to support this. So I think it's certainly something that could be done if it's a priority for the commission.
I think it's an important fund. In addition, that is also our training side. So if you're not training in a realistic way of doing things, then we've got a problem with our training. So I support this. I just want to make sure we can find the money to do it.
The request for that out of our 911 funds would be out of our reserve funds there. So it wouldn't hit the general fund dollars. It would. We watch that reserve fund very closely as things become more and more expensive. So it would be a pretty large hit to that, which I believe it has around $3 billion in that reserve fund. But yeah, the funding is there for it. Yeah. Any other questions on this decision package? Okay. All right, the next decision package is for a technology coordinator. This is somebody to manage all the unique technology utilized by 911, and especially the integration of such and new projects coming up. The price tag for that is around $104,000. We currently pay for 2 application managers over out of IT that work on 911, and most specifically, they work on the CAD or computer aided dispatch system at 911. What has been a gap in that is how we pull all of these projects together. So for example, in just this week, we're still working on cleaning up CAD from cutover and just tweaking. That will be an ongoing process as we're flexing into this system and learning different ways to do things and nuances on it. IT is helping to support that, but there's still a lot of work being done at my level and my deputy director's level, just understanding the operational nuances of what we have and what we need. We have a phone system cut over tomorrow that is going to be a migration onto a different backup system. We've talked about this. It's a AES backup is, I believe, what it is that provides some redundancy in the phone system. If you remember, that last outage we had would have been prevented by that. So that is completely on us to manage, myself and our deputy director, on all phone system projects. And so we also have some opportunity to, once that's online, to start getting video messaging into 911. So trying to figure out what that looks like, how that integrates, where are we going to store it? How do we manage that? What do we do with our staff with that? How do we train them on it appropriately? What do we want to do with this in our system? So those are decisions that have to be made there that a technology coordinator would be taking point on. Our radio system, as we're talking a lot about that today, I have a radio shop manager who does a great job, but he's also doing a lot of bench work and site work and managing things. That shop is a very small team working on that. So a lot of that falls to me to decide, how do we move forward with our radio system? How is it managed? Do we need more subscriber licenses, things like that? And so it's just becoming too much for one person to manage on top of the other responsibilities that we have. And so in talking about a technology coordinator, it is beyond what is happening at that IT support level. That's more down in the weeds and minutia of it. It's that higher level of what's on the horizon, what do we need to bring in, how does it work with our agency needs, our employee needs, and how does it all work together in our system?
So would this person work for helpers or would it work for you?
Who would work for emergency communications?
And I've always had a concern whether we have people that don't work for helpers organization that can do things to overall communications here in the county that may affect other things that they're not aware of if they don't work for his organization. So I want to make sure that if you put it in your organization, that they can't go making changes that's going to impact the overall organization.
To that point, I'm serving in this role now and I'm making changes and they're not impacting the overall organization. So the work is already being done. It just would be somebody other than myself or the deputy director doing it. So, and I absolutely appreciate everything that you're bringing there because I don't like it when other people make changes that then bring down things in my system. And so absolutely, we are cognizant of that. And it would be, again, is in our vision of it, there's that IT level work that's again more down in the technical, minutia of what's going on. And this is a higher level of how do we keep technology present and innovative within 911 services in a way that serves the system holistically. I absolutely appreciate your
A couple years ago, when I tried to start moving everything under IT, because everybody was doing their own things and it was impacting the rest of the organization. So please work with Mike and make sure that whatever you hire in this position is something that can work exactly with his entire system.
Absolutely. We are pretty lockstep with IT. I believe we work very closely together and we would continue to do so absolutely to preserve that very thing.
Thank you.
Any other questions on this one? Okay. The radio consultant is our next decision package. And so giving some history on the radio system and the radio shop, I think is pertinent to this discussion. The radio shop historically was under emergency communications. And then at a certain point, and I don't know the year, it was before my time, it moved over to, well, it was before my time in a position to care about it, I guess. It moved over from 911 to Fleet, and Fleet was managing the radio shop at that point. They had 5 people back to 2007, which is as far back as I could go in the budget history without getting more involved in it. But they had 5 people assigned to the radio shop in 2007. At a certain point, because of some personnel issues in the radio shop, 911 chose to not have the radio shop provide maintenance support to the radio system as a whole. So they did radio programming on subscriber units, those portables and mobiles, but they did not serve the system at the tower sites, for example, the microwave network, things like that. And again, they had 5 people for that. In 2010, they lost 1 position. So there were 4 people in the radio shop at that point. And then in 2012, it went down to the 3-man shop that it is today, or 3-person shop that it is today. In 2018, the radio shop moved out from Fleet back to 911 very appropriately because, for example, why they went down to 3 people, we don't really know the decision making on that because it wasn't a 911 decision because they weren't under our purview. In 2000 and backing up even before that, in 2011 on our radio system, they began providing the maintenance to the system as a whole versus just the subscriber units. That decision was made because there was a better response out of the radio shop versus the vendor that we had in making sure that things were working. If a tower site went down, if the generator went out, things like that. So, excuse me, they took back over that work, but we did not add any staff to the radio shop. And then again, in 2018, they've come back under our purview. What we've discovered since then, as we have continued, we have around 11,300 radios on our system that could be active at any time, or around 1,500 that are active at any one time, people out in the field using them. So there's a lot of system activity, a lot of people to manage. And in that management and getting to just the day-to-day of working on fire station alerting, we also do installs on technology. We install radios in ambulances and sheriff's vehicles, work on wiring, programming, troubleshooting, all of that. we have lost a little bit of control of the system as far as how it's managed at a partner-to-partner level. So we have some partners, for example, that we've allowed them to do their own radio programming because their programming needs were outside of what we were able to accomplish. And it was creating frustrations for them to not be able to have radios programmed as frequently or timely as they wanted them to be. So as we're looking forward to what we want to do with our radio system, we've also recognized that there's a lot of vulnerability in our radio system. As we look at malware attacks and things that are happening throughout the country of ransomware and things like that, our radio system, it's a digital system, it's an IP system. And so the opportunity for somebody to take control of that is a valid concern. And that would be to our detriment, as that's a very main component for us reaching our field personnel for their safety, for their alert of what's going on in the system, and knowing where help is needed. So that's one component of this consultant, is to evaluate our system, to figure out whether or not we need to tighten down some of these things to help. How do we have all these partners interact on the system, and what is the best practice for that to maintain the integrity of the system, the safety and security of it, while still serving our partner needs? Whether or not we need to expand our radio shop and what that recommendation would be, best practices for the number of users we have on it, just somebody more educated in this field to come in and provide some direction. That's one component of it. The second component, as we've mentioned, is that in 2028, we're going to need to have something in place, a plan in place of what we're going to do with this radio system. Once that maintenance support goes down, if we were to have a site go offline, something crashes, we're just without that site. We aren't going to be able to bring it back up in any efficiency or expedited manner. So the time is now to start deciding, do we need to, Motorola has some options of some multi-year replacement plans as we replace different components each year at a smaller price tag each year. We could decide to go out to RFP and just create a whole new system, which would be a more expensive option, but maybe what's best for the system. I don't know that. I think that that's it. But that's part of what we want that consultant to do also, is to look at what we have hardware wise on our system, what's good, what's not, what's coming into life, but still has some life in it, and just help us to know how we want to move forward within this system. Any questions on that? Okay. Next, we have fire station alerting. So on our fire station alerting, our system that we have now was originally installed back in between 2002 and 2004. We can really pin down when this happened. This was before my time. Then in 2012, we did an upgrade of the system where we replaced some pieces of it. Some components stayed the same, and the intent was to go over to an IP-based system from an analog system. And what we have ended up with, we've now discovered, is kind of a hybrid IP analog-ish system, and that our vendor Zetron doesn't even understand how we ended up with what we ended up with. So back, even before going on to the new CAD system, we began to recognize that this has been ignored and we need to get this replaced. We're out of support from the vendor, which is Zetron. And thankfully it's been chugging along this whole time, but we were definitely in need of looking at a replacement for it. This became very on our radar, and we were hyper aware of it when we cut over to our new CAD system on April 18th. And everything that we were told was going to work in connecting our computer system to the fire station alerting system did not work. So we had about, a week of having to manually alert the stations, which still works, but it's not as efficient as staff is multitasking at an extremely high level as it is, and making sure that stations are getting alerted in a timely manner. As we ran into this issue and connecting it with our CAD system, as we're calling Zetron, all we got was, well, here's the user manual. We had, thankfully, the radio shop supervisor who was there at the time of install, out of the graciousness of his heart, came and helped troubleshoot some things just on his own time. We had a lot of resources thrown at it, and everybody was scratching their head, wondering how we ended up with the system that we ended up with. So it's a bit of a Frankenstein system. So absolutely in need of replacement, and reinforced what we already knew. So in looking at this, we are issuing an RFI this year to get a better handle on what the cost is going to be. So this $2 million is a very steep price tag, but it's a projected cost based on a quote that the city of Wichita was provided for fire station alerting that they were looking to replace. So their quote for the entire shebang of replacing fire station alerting was 1.7 million for 22 stations. We have 34 stations, and that included support, which I did not include in our quote. Well, let me back up and clarify. Their full quote was for 2.6 million. That included some extra options, some in-station hardware that we would not provide. Our agreement on fire station alerting is that we provide everything from CAD up to the station hardware. So once they receive that signal, it's up to the station and the department themselves what bells and whistles they have on the other side. It's not a capability in this current fire station alerting system, but if we were to get a new system, they have the ability to have some different components that would wake them up differently. If it were after hours, some tickers on the board. I think it'll open up garage doors and sing songs. I don't know what all it does a lot of things, I guess. And so that's not our responsibility. Again, ours is just up to the station. Once they've received that signal, what they do with it is on them. So the quote for the city of Wichita was 2.6 million with those options and support. And fishing through this to figure out what that costs just for our piece of it, the fire station alerting, the main component of it in their quote was 1.2 million, which was for 22 stations, not including support. As we extrapolate that out to the 34 stations that we have, that includes Sedgwick County, Wichita Fire, and the 2 Derby stations. That cost was around $56,917 a station, which ended up being 1.9 million for all of those. And that also does not include any repeater equipment, which is included in their quote, because I believe we would be able to handle that under our current radio system without adding any repeaters. So again, trying to get an RFI issue just as quickly as possible in the midst of everything else going on to get a better price tag on that. So we may not need 2 million if we were to replace that. The goal would be to not spend 2 million, but that was where we ended up just in ballparking it. Any questions on that?
We also have 5 volunteer fire stations. Would we be responsible for getting them to those?
At this point, none of our volunteer fire stations have opted to have fire station alerting in their stations because by nature of a volunteer station, it's not very often that somebody's sitting in the station. We did lose alphanumeric paging when we went over to this new CAD system, as the understanding from our vendors that that's a very antiquated technology and we needed a tap server to make it happen, and tap servers are not being produced and we could not get our hands on one. IT tried to find a solution for that and we're unable to. So we are exploring different alerting options right now with our volunteer fire departments because they're not in station all the time. And they do have active 911 working and works much better on this CAD system than the previous one. They are also getting notified via text whenever they're dispatched on a call, and then of course by radio. But there's more discussion to be had on what we can do to better support that notification on the volunteer side.
Okay, well, I appreciate it. We are the ones that notify the major fire departments in Wichita, Sedgwick County Fire District number 1 and Derby. And so I believe we need to deliver that to those locations. I'm not a big fan of trying to worry about the volunteers at this point in time. I've got some other issues with that.
Okay.
Thank you. Do you have something?
Go ahead. Just want to make sure I understand. So in Wichita, the estimate you said 1.2, I understand their number. They'll be paying for their 22 stations to be upgraded on their side of it.
They would, yes.
But our $2 million is to take care of both emergency communications and our 34 stations.
Correct.
I'm just curious why we don't capture the 34 stations in the respective budgets for EMS and Sedgwick County Fire District number 1. Why is that in the emergency communications budget versus the?
I think because it's an alerting system.
Right.
So I don't know why it would necessarily fall into those. I'll defer to Laura or Rusty if they have comments, but.
The alerting from CAT, part of the part of the statutory requirements in the 911 tax fund is that that funding covers everything from receipt of the 911 call to notification of the responding personnel. And so, and I wasn't there when, I guess it was decided who was going to pay for fire station learning initially. That would be my assumption of why that's always fallen under our budget. That's part of that notification of the emergency response required or requested. And so that's why it's under our station, if that answers your question.
Just seems a little arbitrary to me. I guess I don't know why it's the way it is.
I can contact legislative research and see if they have anything on anything that was in place at the time that would have said a 911 entity that's licensed through the state is the appropriate body to have that.
No, I can accept where we are. I don't need you to go through that much trouble. I just think it's a little odd. Again, Wichita's paying for their own. So their fire department's being funded through the city, and they're paying for their own. We're using a tax fund for 911 to pay for Sedgwick County Fire District Number 1's alert system. They have their own taxing jurisdiction, much like Wichita has. I'm just interested, why are we doing it for them? And again, I'm okay. It doesn't make sense to me. It seems like it's inconsistent here.
We're paying for the alerting system for all fire departments for
On
Wichita.
the
Sedgwick
emergency
County.
communication side,
Correct.
but you're not paying for the
I don't pay
1.2 million
for
for Wichita Fire Department to have their system upgraded inside their 22 stations.
I don't know why they were looking to do their own alerting. I can't answer
what I'm
that
saying.
question.
I assume Derby's gonna pay for their
No.
own stations to be upgraded.
That all of those costs for that alerting is what's included in Alora's decision package.
I'm so sorry, I've got to interrupt. That's not, that we would pay for the alerting to the transmitter in the station for Sedgwick County Fire, Wichita Fire, and Derby Fire. It is the onus of each one of those departments to pay for their own hardware on the other end. We're not paying for hardware within county fire stations, Derby fire stations, or Wichita fire station.
But the $56,000 is more than just that transmitter receiver at the station. It's also system elements at the station that does things, no?
No,
Okay.
no, that pays for the equipment, the server equipment that's at 911, how that interacts with CAD, how that alerts through our system, getting that signal from dispatch to the respective station. There's a radio and transmitter in the station that digests that signal. And then from there is the handoff to the station on how they put it out. I'm so sorry, I misunderstood you.
So when we get our fire briefing here in a little bit, assuming that this goes forward, we might need to upgrade the Sedgwick County Fire District Number 1 stations and our EMS stations, or whatever, to upgrade the facility side of what happens once that transmission is received by that post. Then whatever happens at that post is probably going to require some type of technology upgrade, and that's something we haven't seen yet.
Correct. So one of the things we talked about at the advisory board meeting in February was that this was going to be, or excuse me, it was in early April, that we were going to be looking at fire station alerting as part of our budget. That then, the individual stations or departments, would have to look at what they want to do on their end. With the equipment they have in station now, we could upgrade our components and they could continue to receive that signal hooking into the equipment that they have. So they don't have to upgrade anything right now.
Okay.
I think some of them may look at it if we get this approved.
And I think I already heard the answer, but just to make sure I clarify, the tax fund has a balance to cover this as well. You said you have about $3 million in the tax fund.
There is a balance. I don't know if we want to deplete it all at once. And I don't know that all of it would be eligible. There may be some I don't know. Would it all be 100% eligible to be paid?
I
for
don't
by
know if the
911
components
tax
in this station would be, my understanding, and I can confirm it, is with the coordinating council is that at the dispatch center would be the servers and equipment for that. I would be leery of depleting that fund with costs we have.
So is this something
But
we can stage into over time, or is it something you have to kind of do it all at one time?
Well, and this is why we're getting that RFI, because we don't know yet. And so we're trying to figure that out. I know that once we change out that server, the large chunk of it's going to happen at once, if not all of it, but we will find out more.
If there's not enough, if there's not sufficient funds in the tax fund to do this,
Mhm.
then what other option is there to fill in the shortfall? Where does the shortfall come from? General fund? And then we pay that back later on, or is this just gone? Oh, okay, thanks.
One last question.
Yes,
This covers our backup location at the law enforcement training center.
Yes,
So you're
yes.
not gonna come to us 2 years from now.
no, I will not be coming to you 2 years from now. We have fire station learning. We've always had fire station learning through the backup site as well.
Thank you.
Yes. Any other questions on fire station learning? Okay, the last one is Critical Connect. There has been a lot of discussion about in-building coverage for radios, for public safety radios. And so this is part of what could speak to that, but this Critical Connect from Motorola, it provides a bridge between our radio system and the statewide radio system. There are two things that brings to us. The first one is a failover capability that's seamless to end users. If we were to lose our radio system, it would roll them over to a channel or talk group on the state system, which is part of our backup plan for the radio system currently, without them having to switch channels. I know that seems pretty minor, but anytime we've had any sort of radio system interruption or testing of the backup plan for radio systems, getting end users to understand how to change channels on their radios is a challenge. And so that would eliminate that challenge, especially in the midst of an emergency situation. If we were to lose our radio system, I certainly don't want to have a firefighter while fighting a fire also worrying about where to switch his radio to have coverage for that. So that is one piece of it. The other part of it that speaks to this coverage issue is that it does provide LTE coverage for LTE capable radios if RF coverage or radio frequency coverage is lacking. A key piece of that is that it has to be an LTE capable radio, and I'm not aware of any radio in our system, not only Sedgwick County radios, but other agencies that we support that have LTE capable radios. That may be a component or an upgrade that they would want to purchase in the future. They knew that this was available, but that would help with that in-building coverage frustration that is occurring within from our system providers. And also I know that our building community is frustrated with some of those requirements for that. Questions on this? All right.
In summary,
So I'm just asking for a mere 4 million. I mean, I don't know what, you know. Anyway, I know it's a lot of asks, but a lot of hot topics surrounding emergency communications and needs of the system. So it's about $3.8 million. We have nothing to reduce. We don't create revenue. We just ask for things. So.
Laura,
Mhm.
first of all, I watched you on TV a couple nights ago on Channel 12, and you did a great job.
Thank you.
You answered all the questions. My only concern was that I don't believe that they were listening to what you had to say because they'd already made up their mind. So they were trying to make the story instead of report a story. So I was very disappointed, especially when they went into it with the anchor saying 50% of the time, 911 isn't going to answer your phone, and then over to you, reporter, to explain, or at least not listen to you explain. So I wanted to let you know we fully support what you do. And just to clarify, the way I understand it, we knew we're short on people. You briefed us that we started today. But when someone dials 911, if they're not going to be able to answer immediately, you got a recording that says, hey, you did reach 911. Please stay on the line. We'll get to you. And from what I understand, those roll over to someone to answer within like 5 seconds. Is that not true?
It's 5.6 seconds is our average on that. Yes.
5.6 seconds. So that's not the way they were reporting it, though. They were reporting it half the time, you're not going to get it. And then they interviewed some people that said, oh, it takes hours in order to be able to get somebody to answer 911. So I wanted to make sure that the public knew that you all are doing a great job. And if you call 911, yeah, you might get a recording initially. That way, you know that you contacted 911 instead of dialed the wrong number. And your staff is there to support all of our citizens in this county. And I am very proud of the work that you all do over there. And I think that you did a great job of trying to answer a very biased reporter's questions. So thank you very much.
Thank you.
I'd like to add to that as well. You come to our CAB board a couple of times and there was a lot of negativity, which is why we need you to come out. And you did a tremendous job. You're extremely good professional at what you do, and you did an amazing job answering all the questions. And so I want to say thank you. I also saw that news report. I would agree with everything he just said. I would like the county commission and the county government to be on the offensive a little bit. We're playing defense, and unfortunately, the narrative is being created by people who want to say a story that sounds alarming. And the end of the day, I also am extremely proud of our 911 emergency communications. I think you guys do a great job. When people realize how good things are, we have got it really good in Sedgwick County. And at the same time, the very same people that complain about this response that they don't understand, in fact, it's been mischaracterized entirely, they're also screaming for tax cuts. So this is basic government. This is the best part of government is our first responders, and what you do is the very first step of that response. And so when you ask people, do you want us to cut 911? They always say, no, of course not. But they want tax cuts. At the end of the day, it's a bit irrational for people to demand more services and less cost. It's irrational. But anyway, I appreciate all you do. I want to tell you and your staff, I'm proud of you, and I think that we need to be on the offensive with our messaging. And with that, I've asked manager, I wish we could have a briefing when we invite the TV cameras in, and actually let us have a workshop to kind of explain what's going on in Sedgwick County and really encourage them to report the accurate story. Thank you.
Thank you. All right.
Thanks, Laura.
Thank you. Appreciate it.
Thank you, Laura. Okay, we will move on to emergency management with Director Julie Stimson on page 321.
Good afternoon, Julie.
Good afternoon, Chairman, Commissioners. Julie Stimson, Sedgwick County Emergency Management Director. This will be a fairly short presentation.
$4 million.
No, we're not there. No. So our manning looks like we're at 80%. We have our planner position is actually vacant, but I'm happy to announce we have given an offer to one of our candidates, and hopefully we'll get the phone call sometime this afternoon with an acceptance. So we'll be back to manning. So I believe that we'll be 100% manned, probably come within the next month or so. 5-year strategic goals. Our goal 1 is to serve as the county's leading expert in contemporary emergency management strategies and practices. Inspire whole community all hazards preparedness and resilience through active volunteer programs, community outreach, and education efforts. We have really, in the last year, have really strengthened our volunteer teams. Last year alone, between the K9 team, Gracie's team, our CERT, we were able to calculate $150,000 in volunteer service hours for our community, and it's only going to grow. Our community emergency response team, we've got about 20 individuals who are interested in being in the advanced team, which will be helping us get out into the communities, give us more outreach, and even help us reach those most vulnerable populations that we struggle to get out into. So we're really, really happy to continue recruiting our volunteers, training them, and it's all at the cost of maybe a t-shirt and some PPE. So it's low cost, but they are providing a huge service for the communities. And then ensuring optimal disaster prevention, preparedness, all the disaster response through active stakeholder participation and plan development, training and exercising, as well as coordination of response and recovery efforts through a Ready State Emergency Operations Center. Some challenges and opportunities. Opportunity for change is that continued 6-year capital improvement project to replace our outdoor warning system. We are in year 1 of that approved plan already. And it's crucial. That's pretty much the only real ask I have for my department is we absolutely have to have that outdoor warning system working, more reliable and more cost effective. Another challenge is time to train and coordinate the volunteers. we want as many volunteers as we can, but we also need to have people to provide training and to also manage. We have 500,000 people in our communities, and even if half of them sign up to be volunteers, we need some help managing that. So that's a challenge. And then also the training classes themselves are primarily in the weekends, and we're trying to have classes within all of the communities. So 21 jurisdictions is a challenge as well for a department of 5 to manage. So we're having some challenges with that, and I'm going to talk a little bit about what maybe some of our solutions may be for that. And then, as you are well aware, we also have the need still for that permanent disaster preparedness PPE warehouse emergency operations center project that we have other meetings and discussions with grants and other stuff for that project. So the budget request, it looks a little cattywampus a little bit. We're going to discuss it. The personnel costs, the reason for the reduction is because our ARPA funded logistics chief is still going to be ARPA funded for another fiscal year. So that's why it looks a reduction, but it's still there. Our contractuals and commodities, we have the EMPG grant, the Emergency Management Performance Grant. They actually increased our reimbursement funding last fiscal year, kind of unbeknownst to us that was coming, but it was based on our increased population. So the state did some recalculations and bumped up our grant by about $58,000. And then they also allow us now to use that funding for more than just salary. So we're able to use that to do things like support our volunteer programs and support our outreach and some of those things that we've struggled to meet in the past. So that's actually going to change once we kind of get our EMPG funding kind of squared away and applied for. We'll go through the grant application process when the time has come, probably within the next 30 days or so. And then our inter-fund transfers, that is that CIP. We did the $328,000 in 2023. And through the CIP process, we'll be almost doubling that request as projected in that 6-year plan that we presented to you. So that's why the numbers kind of look a little strange, but they will be fluctuating by the time we're through this budget cycle. Do I have any questions on that? Okay. That's it. Yep.
Sounds good. Thanks.
All right. Thank you very much.
Thanks.
Ready to keep going? Okay, we will be emergency medical services with Chief Kevin Lannerman on page 326.
All right.
Hello, Kevin.
Good afternoon. Chairman, Commissioners, thank you. I'm going to talk a little bit about decision packages. Did you get the new handouts for Justin's going to pass out. We had some last minute changes, so
Thank you.
So as we go through our presentation here, the first is our org chart here with our current staffing levels. As you see that we're about 87% staffed overall. If you look over in the operations side, if you take out our part-time personnel and reserve personnel, we're about 95% staffed at this point with our full-time personnel over in operations. So that's good news. Our mission services, we are committed to providing quality out-of-hospital healthcare. Of course, we are the exclusive provider of EMS services to the cities, all the cities and rural areas of Sedgwick County. All of our ambulances are ALS, advanced life support equipped. And we also do non-emergency transports and facility transports throughout Sedgwick County also. We are funded by a combination of user fees and of course our tax subsidies. Our strategic goals is to ensure resources are efficiently and effectively meet the needs of pre-hospital healthcare demands of the community. Promote a culture that prepares and empowers the workforce to provide quality care and ensure customer satisfaction. Provide compassionate, patient-centered care to positively impact the health and well-being of the community. Easy for me to say. And the last one is we'll respond to all emergency calls in less than 11 minutes, 90% of the time. We'll take 2022, we were just above that, about 12 minutes. And that is a countywide response time goal that my staff and I have kind of been looking at, whether that's a good goal to have, or if we need, previously that was separated out to, you know, the urban communities, suburban, and then the rural communities. So we're kind of looking at that as we go through our strategic planning in our own department. So on the 5-year horizon for our challenges and opportunities, you know, our personnel recruitment and retention is going to be still at the forefront. We are nearing full staffing and anticipate you know, needing to expand in the near future to meet future demands of our EMS call volume. That staffing has been, as Rusty alluded to at the beginning, improved due to the compensation that you all have approved. And our EMT to paramedic program has been a big success in continuing that pipeline of paramedics that we're growing in our own service. We also want to increase the capabilities to align with the industry standards. The critical care scope that was once limited to a few individuals, we want to expand some of those treatments out to our frontline paramedics to get those get that care to the individuals as soon as possible. We also want to look as we get fully staffed and are ready to expand, maybe some alternate response models such as telehealth and mobile integrated health, community paramedic, things like that. And continue to expand employee education programs and continue with, like I said, the EMT to paramedic program. Any questions as I go along, please stop me. So this is our summary of our requested budget. Some of the increases in commodities, of course, due to the increase in price in a lot of our medications, equipment, or supplies like that. We still did have the inter-fund transfer. I think that's still part of going from into the general fund from our EMS special fund. So, and then the personnel, we'll talk about that here in just a few minutes. So our package number one is to fund 31 of our positions that are not funded right now at the paramedic level or above, back to that level. As you all know, turnover rate in EMS in previous years has been pretty high. We had struggles filling our paramedic positions so that we could keep ambulances on the street. We ended up hiring EMTs to fulfill our staffing levels, and through the years, they've been funded in our staffing table at that lower EMT rate. So this ask is to get our staffing table back to where it was previously and fund those positions, fully fund those at the paramedic level. The request is $568,000, and that would allow us to hire more paramedics as we're getting them. Right now, we're getting to a point where we don't have, you know, paramedic positions to put them in. So this would allow us the flexibility to get those paramedics on board and get them hired. So.
Couple quick questions. I'm thinking about your staffing chart still, and curiously, to get to that 95%, you said you take a couple things off the chart there. If you consider that, we're 95%, but are you counting the grow your own folks that are in that training are they reflected on this table? Because they're not actually available for.
They are reflected in there. They are still full-time personnel that are working for us as part of their EMT to paramedic program. They're maintained full-time. Part of the cost of the EMT to paramedic was backfilling their positions while they were in class and things like that, but they're still considered a full-time equivalent on our staff.
But this table doesn't, so we say they are available to take to do their normal duties and take calls and assist with the response crew and all that stuff.
As to supplement their 42-hour work week. If there's class time, whatever is not equal to that, then they're required to work on the truck to get to their full-time 42-hour work week.
Okay. I don't know when this was done, but a long time ago.
Mhm.
When I was just first got here, I think maybe it may have been a long time. I don't know when it was. But there was a study to determine how many was the proper number of units to be on, each day of the week, and each time of the day. There's a goal number of ambulances or crews to be out there. And the number was sometimes as high as 23 units, 24 units. That got knocked down a few, I think, because we had staffing shortages. And there was a time there, I think our goal was like 21, maybe even 20, and we were woefully under that, actually. That study that determines what's the proper number of ambulances to be on this, in the community. I don't know what you call that study, but when's the last time that's been done?
It's been quite a while that I know that that's been done. We have a chart that shows what our average call volume is at each time of the day and where we're staffed to now. The last, I don't know if you have our 2022 operations document. It has kind of I don't know if you can see this graph here that kind of depicts the number of units with the margin that is needed for surge, things like that. Because you never want to staff just to what the expected call volume. You need an excess of units available for unexpected surges in call volume. So we are down at 19 during peak time of the day. And as you can see on that chart, it peaks during the.
We're down to 19 right now.
19 during their peak time and 13 units 24
Oh, we should be
hours a
about
day.
21 or
Probably
23.
about 21 at the minimum. That's correct.
So, okay. And then that was, I assume there's probably times during the daytime where we're hitting status 3, 2, or 1, maybe even status 0 because we don't have enough.
We still are. It has decreased because our staffing's gotten better. So the amount of units that we're having to shut down has decreased substantially. But even when on days when we're fully staffed, have no ambulances shut down, we're still occasionally getting down to that status.
I strongly support the change in your goal to urban, suburban, and rural goal. I think that's a very good choice. But in terms of your package here, it sounds like you're changing from EMTs to paramedics. And I think reality is, I think what we ought to do is keep the EMTs and add paramedics. I don't know that we ought to, I'm not so sure that you have the right number of FTE count. If we have to have more crews on the street, if that's where we're headed, then your total number of FTEs is probably not where it needs to be. And again, rather than converting from EMTs to paramedics, again, that probably is a great change. It sounds like we're just short on people. And to get there, we probably need to have EMTs as part of our mix still until we have
part of my second decision package kind of answers that a little bit. Also, this is to get us to where we were previously in our staffing table. We only had 4 full-time EMTs in our staffing table. The rest were all paramedic staffed, and that's where this gets us back to. Like I said, in the second decision package, I'm asking to increase that EMTs to actually put more.
I mean, I got ahead of you. I
personnel.
apologize for that.
No, you're fine.
Okay. Thank you. Thank you for the answers.
Kevin, just a few months, a couple of years ago, we were talking about staffing. And at that point in time, it was 1 paramedic and 1 EMT. And then as we got into shorter and shorter on paramedics, we started tracking all the time. And I haven't gotten any tracking numbers lately, but we were down like 20 paramedics for a while. We're trying to build up our paramedics. And we're still running an EMT and a paramedic. At no point during that time did you ever bring up that you wanted 31 more, because now you've moved the goalpost on us where we were tracking, trying to get 20, working every day. How do we get that 20? And now you just moved the goalpost to an additional 31. I don't know how we got.
We're not adding 31 positions. This is just funding the positions that we already have to what they previously were. Through the struggles of previous years, and having to hire EMTs to replace the paramedics that we lost. The funding in the budget they were budgeting for the lower level, the
We
EMTs.
couldn't staff with one EMT and one paramedic. And now suddenly you're saying we can't do that. We have to. staff
We never
with two
said
paramedics.
we wanted to do it that way. We were kind of forced to because we had no paramedics to hire. So we had to hire EMTs to keep ambulances on the street. We never said that was
So today,
what
are
we
we
wanted to.
51 paramedics short, or how many short are we?
If you look at the what is it in that budget up there? So right now we have 31 positions that are not paramedic positions. They're in our staffing table, or sorry, in our operations filling trucks, but they're not paramedics. That's correct. The staffing
So how
truck
short are we? That's my question.
of
We were
paramedics.
reading this for a while and then stopped. And saying, hey, we're 19, 18.
That's because we weren't, according to what our staffing table, what we believe the staffing table was at the time, we changed that to how many providers we were short, because we were filling seats. We were filling them with EMTs instead of paramedics. We did change that to what we thought we were short as paramedics. And the number right now, we have 16 full-time paramedics that are filling and we should only have 4. And we have 4 AMTs that are essentially underfilling paramedic spots. So we're short that many paramedics still. But we have right now, well, we just graduated 4 paramedics, and we have 11 more that are in the EMT to paramedic program that will be graduating before the end of next April. And so that number will be even smaller.
So does this request really belong in the 2024 budget when we're still 20 short today on the original goal? And now you want 31 more. So you're telling us now we're 51 short?
Yes, I understand.
I think that, I think what Chief's trying to say here is he's got a certain number of bodies. Some of them are EMTs and some are paramedics. I think what Chief and Kevin, I'd like you to talk a little bit philosophically why a 2 paramedic bus is preferable for EMS. But he's got a certain number of bodies. What this decision package is about is trying to match the budget book, the budget book with reality of what EMS wants to do to run, and that is to transition EMTs to paramedics operationally. So he's got a certain number of bodies. Your question should be, how many bodies are you short today, Kevin, from the proper number of bodies you need to run the kind of staff that you want? Maybe that. So if you could talk about both of those, if I'm hitting your question, Commissioner, and philosophically talk about the value of the 2 paramedic system versus paramedic plus EMT.
And that's what we like to, and through attrition and through, we're not obviously going to the EMTs and the AMTs that are currently working for us are still going to be filling positions, but through attrition, or when they advance, maybe want to go to paramedic school, those positions will just be put into paramedic. We need them funded as paramedics so that when they go to paramedic school, we get more paramedics in, then we can keep them as paramedics. Right now, they're only being funded in the budget as EMTs.
So can I speak to this very briefly? Is that all right? The history, just clear up history. 2 directors ago, that director was asked by the former county manager to come in and present a paper that was somewhat driven by another commissioner who's no longer here. And it was a scientific paper that talked about the benefits or whether there was detriment to having a mixed EMS unit, a mix of EMTs and paramedics, and the ALS unit with a paramedic and an EMT on it. And the scientific paper suggests that there's no detriment to patient care. This is my lay term reading of the paper. From that came an attempt to pilot that a little bit. It was going to be piloted. They were going to maybe transition a handful of paramedic positions to EMTs. They were going to leave them funded as paramedics but they were going to fill them with EMTs, 5 to 10. Run that for about a year, see how it worked. That was kind of it was unwritten and an informal plan. And then came the pandemic, and then came the departure of the last director, and staffing had declined. And they were hiring, number one, they were hiring EMTs to start this pilot. And then the number of paramedics who left, it grew. And so they had to hire more EMTs. Some of those folks were credentialed at the AEMT level. And so where they're at today, based on a report that Kevin's folks pushed out, is they've got 155 field medic positions. That's medics and supervisors. And today they have 13 vacant positions. So that's where he's saying they're about 95% filled in the field, somewhere around that. That's pretty close. So they've got 120, they've got 113 field paramedics. Right now, their target is 120 field paramedics, and they've got 113. So there's 7 paramedics short. And they've got, how many you got in class?
Right now, we still have 11 in the
Okay.
EMT department.
So if those 11 graduate, which 3 of those won't graduate till like next May, but if those 11 graduated, nobody left, they'd fill those 7, and they'd have 4 overfilled paramedics based on the budget vote. Okay, so they'd be at like 123, whatever. What he's asking is they want to get up to have 150,
150.
152, add another 31, they 151, 152 paramedics.
Paramedics in the.
They want 151 of those 155 positions funded as paramedics, so that they can, as these paramedics or as these EMTs graduate from class, they can transition all them into paramedic positions that are properly funded. And then if they're able to hire other paramedics from those classes or from outside, that they can staff up to 152 paramedics. They'll have a handful of EMTs to fill vacancies. And then he's asking to add an additional 6 EMTs so that they would have then 10 floaters, 10 people to fill vacancies for vacation sick, et cetera. So they'd be up to 161 filled positions if you added the 6 EMTs. But 152 of those would be paramedics, funded as paramedics and filled as paramedics, if that helps clear that up. So,
And those 10 EMT positions would allow us to continue a pipeline of paramedics. We could hire EMTs, we could let them work full-time, evaluate them, have a process for them to go through to apply for the EMT to paramedic program. We could continue, our own pipeline, because most of the paramedic programs right now have affiliated students that are already with an organization. And so there's very few that you can get from paramedic classes that are under either contract with another agency or things like that. So this keeps our pipeline going for years to come with growing our own paramedics for those normal attrition rates that always happen.
when it comes to the manager's question of why is a 2 paramedic operation the more appropriate for this jurisdiction?
That study that was done years ago. I don't know all the departments that it looked at, but as far as clinically not having, saying not have any difference in 1 paramedic or 2 paramedic. I'm not sure what systems they were in. We're in a little different system than maybe some of those systems are, where our paramedics are coming from the EMS. A lot of systems have fire first response that have all ALS first response also. So they're getting a second paramedic. It's just not on the ambulance. We also believe that the big plus is just our retention and recruitment of our personnel. The paramedics are responsible for every call. They're responsible for doing that initial assessment on every call, even if it's deemed a lower acuity call where the EMT can take that call and continue care. The initial assessment has to come from that paramedic. There's also, we're the largest EMS service in the state. We have the largest number of paramedic students in the state. And so when those paramedic students come in, that paramedic has to take every call, because that paramedic student has to be observed and evaluated by a paramedic. So for that 3 months, whatever that student's with them, that paramedic has to take every call if their partner is an EMT partner. And it's just, there's workload, burnout, things like that, the number of calls, our unit hour utilization still about 0.5, maybe the standard's about 0.3 to 0.35. So, we're still working them very heavily. And then when you put all the extra on top of them, we want to keep our people healthy. We want to keep them here. So.
When you and I and Commissioner Lopez sat in a number of meetings with the mayor of Clearwater and Cheney, and we promised them when we got healthy, we were going to start providing better services to Clearwater and Cheney. And so I was under the impression we're still healthy. But it sounds to me like we've gotten around and have a lot more paramedics available now. So what are we doing to Clearwater and Cheney?
We are getting better. I don't think we're where we need to be. And even like I said, we're fully staffed, which we're like 95%, we're still at a 0.5 UHU. I don't think that we're where we need to be. But we're staffing Clearwater and Cheney right now with our ALS first response out there. I think the last was about 90% of the time, which is much better. I think when we met back there, it was about 70%. So we're continuing staffing them on a regular basis. So, and that's not to say, like I said, in the future is we look to maybe increase number of units on the street to cover our demand here, that we can't look to increase, because there's a lot of things that we could do, to increase not only there, but in the urban area too, with some first response vehicles. So as we move forward.
Well, I'm gonna have to dwell on this for a while. Okay.
So this has, even though just because we put it in the budget doesn't mean we're gonna have the paramedics to fill it. So realistically, we're not gonna be spending this much money that year. I mean, this is gonna take years to load up to. So if you had to put any kind of guess on how long it would take to have this many paramedics where this dollar amount would actually be needed, could you even guess how long it would take?
I couldn't guess, but like I said, we'll have 11 more by the end of April or so of next year. We have more EMTs that are going to start in August in the EMT to paramedic program. So realistically, in a couple of years, I would say we would be full, hopefully, with those. We may have some EMTs that decide they're in those positions that don't want to move on, and we're certainly not going to get rid of somebody just because they don't want to move on. So, but with the next ask, having more EMT positions to put those folks in, that will actually open up more paramedic positions, because we can actually put them in the proper positions in HR.
Chairman. Thank you, Chief. And the justification you gave just a couple of minutes ago about why you feel we need paramedics was personally helpful to me. Is the official position this study that we did about an EMT and a paramedic from a previous commissioner from my district? Is this, are we officially abandoning that model and moving to this model? I mean, is that an official declaration of is that our approach? Or because if it's our approach, then we need to adjust the staffing table. If it's not our approach, then we need to not adjust the staffing table. We need to, if we're going, and the justification you made, and it's the second question I'll have is, I'd like to see what the call volume looks like so we can maybe project what's coming, the trend of what's coming. But I think the fundamental question really is this the model change that we're making? And if it is, then we have to address the staffing table.
Well, call volume increases an average of 5.4% every year. There's been some years where it's dipped because of certain things, but that's been over a 48-year period now that it's average. So I don't see that changing anytime soon. My perspective is that study, I don't think took into account the human factor of the people working. They were solely looking at outcomes, and I'm not sure what they base those on. All calls. you have critical calls that need multiple advanced life support procedures done at the same time. If you have one paramedic there, they have to choose, am I going to start that IV and give the patient the medication they need, or am I going to take care of that airway that they need? I have to choose. I don't have another paramedic there to do the other advanced skill. So that decreases scene times, gets us to definitive care faster on those critical patients.
To answer your first question is yes. We have been what I call in a tweener situation here since 2017. We're clear in the air that on that today, the chief wants to go to a 2 paramedic system. So yes, we're making philosophical change, or that's the recommendation. That is up to this board.
I was just gonna say, it sounds to me like the decision package is exactly what he just said.
Mhm.
The decision we're making is to say we're going to go back to 2 paramedics and we're going to adjust the staffing table. That's what this is.
Mhm.
Because right now these positions are being filled by EMTs, AMTs, and E2P students right now. So we're going to intentionally move away from that model to 2 paramedics. And I completely agree. By the way, I was never really in favor of that original idea. The justification for that came from the idea that that's considered to be a normal crew configuration for most places. But when I got here, I think I can proudly say the EMS in Sedgwick County was the best in the nation. I've said that lots of times. But one thing made us different was our certification, like our OMD, our certification process, as well as the fact that we stood up 2 paramedics on every ambulance, and we had a sufficient crew to hit all the calls. We have not really added FTE. I know we're getting to that still. We've not really changed the FTE table in terms of the crews on the street. That has not changed much.
17, I believe, was the last time that we've added.
Yeah, so it's been a long time, and call volume's gone up a tremendous amount since then. And again, they changed the way we report our response times. I think is hiding what I consider to be the best service. Again, going back to what we had before, we had the sort of urban, suburban, and rural goals. We were hitting those numbers, and we were extremely good. And that's why we were the best in the nation. And our morale was high. People climbed over each other to be part of our Sedgwick County EMS crew. We did things really great. And that's one of the things we did better. And this change, I think it was started because someone realized this wasn't normal. We were better than normal. Number 2, we had trouble finding paramedics. Yet our staff, our wages weren't what they should have been. And number 3, we were just being cheap. We had some tough budget years, and this was a way to reduce the budget in those years is by not paying for paramedics. So the $500,000 request gets us back to what we should be. And I agree with it. So, and I just want to say, Rusty did a good job explaining the history of that. There's a lot of people, there's a lot of players involved in that. And I was never supportive of that change at the time. And I think that the former manager, former county commissioner, and the former person for Dr. Brinker was also part of that decision. So at the end of the day, this is a very, very good decision package. Thank you.
I don't want to speak for Dr. Brinker, but I spoke to him a lot about this, and I think he's fully supportive of this model and this change here too.
And by the way, one of the thing was they thought, well, this would be a way for the EMTs to get more experience, to get them on an ambulance. Again, I think having 10 EMT positions and the grow your own school, I think that's a pretty good balance. So I still think it's a great package recommendation.
Any other questions on this one? I don't know. We pretty much talked about the next one, which are adding 6 EMT FTEs. As I said, we haven't really added FTEs that I could see. Ron, I looked since like 2017. And our call volume's gone up almost 6,000 calls since then. So this will allow us to, these 6 initially will allow us to staff what we have better. We don't have any vacation relief positions on second or third shift. It's difficult to get people, part-time people to fill in on those, especially third shift. So that'll allow us to put the EMTs into one of the teams and put paramedics in the vacation relief overfill and to adequately staff. So hopefully we're not shutting down any trucks at night or on second shift. So that's the goal with that. And it allows us, like I said, to continue the MT to paramedic program that's been very successful for us.
Kevin, I've always supported your EMT to paramedic program. I think it's a great way to move forward. My only question, and I guess it's for the manager more than for you, is right now we're filling, we're a long way short of having all your paramedics filled. So is this decision package belong in the 2024 budget or a future budget? Because you can hire EMTs today.
Our goal is not to hire EMTs today.
But your goal is to hire 6 more.
That's to add 6 FTE positions in our staffing table. What that would allow us to do is to the paramedics or the EMTs that would be underfilling paramedic positions. We could put them in these positions. That actually would add us be able to hire 6 more paramedics essentially, since we already have those EMTs in our staffing table.
So let me ask a question. Then I'll answer yours, Commissioner. So Chief, with the addition of these 6, in a perfect world, you'd have 10 EMTs, 6 ready to feed into the grow your own system to turn them into paramedics, and 4 to do the things that you talked about before, as far as billing, etc. That's the perfect world. I think now, to answer your question, Commissioner, I think what the ask is here is to transition and give him the flexibility. And it's true, he could hire EMTs and then you would underfill those paramedic slots with an EMT, which budgetarily means we are then not overspending, we are underspending. And I'd rather underspend than have EMT positions and have him slotting paramedics in, which then causes us to overspend. So we're trying to set this up to get EMS to where they want to get regarding staffing. And I think we're talking a 2024 budget here. At the clip that they're putting people into grow your own, it's plausible that they could get these paramedic numbers up by end of 24 or get closer to it. So I want to make sure that we're accurately depicting how they're actually operating in this budget book, which goes to the community. We want to accurately depict that. So I don't know if I answered your question there, but.
And I will add that even in the classes that are ongoing, the ones that graduate here in August and at the end of the year, each one of those classes have 1 or 2 other paramedics in there that aren't affiliated, that indicated they want to come to our service when they graduate, that are not part of the EMT to paramedic program. So just that 11 number could be closer to 15 or more. So,
Okay, well, I do want to continue grow your own. I just didn't want to put a whole bunch of positions in our staffing table that we know we're not going to fill in the 2024 budget, because it inflates our 2024 budget.
I hope in the near future that the only underfills that we have are those personnel that are going in the EMT to paramedic program, that they're in a paramedic spot because they're going to be paramedics when they graduate, but they're still EMTs. So those hopefully in the very near future are going to be the only underfills in our staffing table. So
Thanks.
any other questions on that one?
I don't, any other questions? You guys got any questions? Yeah, okay, no, thank you.
And the last decision package is 1 full-time FTE in the EMS in the billing QA specialist. This person reviews electronic patient care reports for completeness and accuracy, and ensures any additional information that is needed is done prior to being sent to our billing service. This directly impacts, our revenues, getting timely revenue back after a call of service date. Currently, we have 1 billing manager. We have 1 full-time QA and specialist, well, actually just doing quality assurance, that we have extended an offer to, that's hopefully going to be starting shortly for that open position. And this would add a 2nd full-time position under our billing manager. We currently have 6 part-time positions. Those are sometimes not always, a reliable way of doing business, having all part-time. This would allow us to have another full-time person. As our call volume increases year after year after year, our billing gets busier year after year after year. So that's the request here. And the goal is to keep the 6 part-time, but this full-time position may take place of a couple of those part-time through attrition and things like that down the road. So that figure there may not, we go down to like 4 part-timers, then that figure there would probably not be as high as it is. So.
It says in here that this request was reviewed by Human Resources, not to put you on the spot. Sheila, can you comment on this?
EMS works with HR in reviewing their job descriptions and the workload. So we have worked with them on this position.
Yes, we had the HRs over there for quite a while looking at the whole billing department, the billing manager position, and the current position that's open that we're hoping to get filled here soon. And it was their recommendation that what they did and the amount of work that was going through there, that we should have another full-time person in there.
Questions? Yeah.
Just more of a comment, in case anybody thinks it's a good idea to privatize this. It doesn't work. We tried that before. Remember that?
The billing.
The billing.
Oh, yeah, no.
What a nightmare. And it didn't go well. I think Commissioner Dennis, were you here at that time?
Well, we have privatized.
We had,
I know.
We are outsourcing now.
Outsourcing.
we do outsource our billing.
Outsourcing is a good idea.
Yeah.
Insourcing
But
is a bad idea.
these folks have to look over every EMS chart. Brian could probably speak about this a lot better than I can of what they do prior to the bill getting sent to our
Well,
billing vendor.
Me and my wise ideas, I learned a lesson on this one. It didn't go well.
Yeah.
And I learned my lesson, just to trust you all on this one. This is probably money well spent. They'll pay for themselves, no
Yes.
question. Thank you.
That is true.
I was wrong.
Mark that down.
Okay.
I'm actually wrong on a lot. Y'all know, they're not keeping very good track here.
Any other questions on? So in total, it's the total ask, like I said, it's a little over $1 million, but as Commissioner Lopez, that the initial for the funding those positions isn't going to be all at once. That's what it would be if we were fully staffed with all paramedics. So at the point, I'm hoping that we'll get there very quickly, but that won't be all at once. So.
Very good. Any other questions?
Anything else?
Okay, thanks, Chief.
All right, thank you.
Thanks for all the progress you've made in the last year and a half, 2 years.
And EMS week coming up in a couple weeks, so
What is?
get to let you know what a great job our providers are doing here in a few weeks. So
Another picnic and stuff.
yes, sir.
Okay, all right.
Yes. Thank you.
Okay. We take a 5-minute break, maybe. We are on page 38 of 90.
We'll be on page 347 when we come back. Okay, following the intermission, we're back and we will go to the fire district. Chief Doug Williams will come up and start us off for the second half.
There he goes. Goodbye, Mike.
That on video. I hope it is. Chief, this is a very serious meeting. So
I know. Yeah.
all right, focus, everybody.
All right. We get started on the fire district. Our organizational chart, right now, we're staffed pretty well. We have 4 shortages. It's a little bit of a misnomer because we still have 5 recruits in class. So they're technically not out yet. They'll be out June 2nd, which will make us down 4. We did have a recruit resignation, so we'll still be down 5 actually, because we had a recruit resignation. So that's where we end up there. Our mission and service is an all-hazard organization which provides fire protection, emergency medical services, technical rescue, hazardous materials response, community risk reduction, and emergency responses. SCFD1 is comprised of 9 fire stations staffed 24/7, 365 days a year by firefighters who are emergency medical technicians at a minimum. Our response area is 618 square miles, protecting approximately 75,000 residents, which includes the cities of Bel Air, Keachai, Park City, Mays, Bentley, Andale, Garden Plain, Goddard, Viola, Hayesville, and Furley. SCFD1 is funded through a district-wide property tax. Our strategic plan is to identify opportunities right now for cooperation that improves service delivery for the public, to develop a recruitment plan to enhance employee candidates by working with area technical schools, high schools, colleges, and other fire departments. Retention of personnel, which includes providing good advanced training, career path opportunities, pay and job stability, and retain employees. The strategic goal 4 will be for the mental health and substance disorder advocate. One of the problems we're seeing in the fire service and all emergency services now is mental health issues. And we want to be that in collaboration with Health and Human Services to have dedicated resource to meet the mental health and substance abuse demands of both our staff and the community. Some of our challenges and opportunities. We are facing the same problems almost everybody else is with recruiting, hiring, and retaining quality firefighters. Our continuing fire education and in-house training is a challenge. Continual complexity of maintaining and repairing apparatus and equipment. Manage increased costs for equipment, PPE, service, and utilities. Our PPE has just went through the roof. And not only has it gone through the roof now, but now the NFPA and others are contesting that a product in fire protective clothing is cancer causing. So my only guess is the solution to that problem is going to make it worse as far as costs. So we don't know where that's going.
Is that a recent ruling or study or something?
It's just come out in about the last 2 years. They call it PFAS. It's a chemical they use when they make that protective clothing. And now
it holds the contaminants.
No, it's actually itself a contaminant.
Oh.
And so, or a cancer causing agent. And so we're looking at now and it's in every manufacturer's gear. So we don't know where that's going, but I'm sure it's going to cost us a lot more. Some of the opportunities we have is we continue to cooperate with our neighbors, whether it's WFD, whether it's Derby, and try to provide better response and better programs with them. Work with the fire district stakeholders on the steering council that we have coming. And we're currently working on a drone program to enhance our response capabilities. We believe that this will help us out with manpower and doing a lot of things that require a lot of labor intensive stuff on scenes. The fire district budget, our personnel costs are projected right now to go up 4.23%. The contractuals are projected up 10%. Debt service, which just is all being driven by purchases and of apparatus mostly, isn't that correct, Lindsley? So that's going to vary based on what trucks we have coming. Our commodities are down a little bit from 2023's revised, and they based it off of 2022's actuals. Our equipment, this is the amount that we use to buy. It goes up and down every year based on what we need as far as replacing squads and brush trucks. It's for cash buying our small fire response vehicles. And all total, our budget with contingency comes out to 24,633,551. Our decision packages, the first one that we've put pushing for is the fire fleet mechanic. The rationale we have for this is that we have 2 mechanics is all, and they're operating 24/7 on call. The 2 individuals are on call 50% of the year each. And the workload is increasing and our fleet is getting more complex and requires those guys to get more and more training. And additionally, they have the last 4 to 5 years, they were averaging 1,000 hours of overtime a year for those 2 positions. I've argued for these positions almost since I've been here. I will tell you, we have incredible mechanics. They're better than any of the private vendors around. And if you want to cripple us, this is where you cripple us. And right now, for us to get a fire truck worked on, we have to take it to Kansas City, and they're trying to hire our mechanics. So this is a place that we really need to focus on, and we need to help them out, get our work done, and also to provide, a better work environment, because being on call 50% of the year, I think, is asking a lot of personnel. Their credentials, they have EVT, which is emergency vehicle technician, and it goes on and on and on. They're certified to work on our aerials. They're certified to work on all of our pump systems. And I could go on and on. And I'm very passionate. I think that if we lose these 1 or 2 or both of these individuals, that it'll be very detrimental to us. And outsourcing doesn't work very well for us because of our specialty stuff. And we build our own brush trucks in-house. And Chief Turner, actually from Derby, called me the other day. Our newest brush truck's brush 36. And he called me and he says, that is a great truck. How much did it cost? And I said, well, I don't know. He goes, well, I have a bid for $250,000. We did the research and we think we have 125 in it because our mechanics build it in-house. So, I mean, when they're building these setting up these squads and brush trucks in-house, they're paying for their salaries by doing that. And one of the other things I tried early on is I said, let's just farm it out. We can go pay, one of these companies that sets up patrol cars, or, for these small towns, or, we can go farm out that work to be done. And number 1, you have a quality issue. Number 2, every time you use a different company to do it, it's set up differently. And their comment is when I'm out here and this squad's broke down Saturday night at midnight, when it's cold, if we build it, I know how to fix it. If somebody else builds it, I spend all day getting it towed in and trying to figure out what's wrong with it. So besides saving money, there's a tremendous value in them building them all the same and constant, and to where they know what's going on with them. So we believe that, we talked to Bo over in the fleet briefly, and, he said that he's trying to get more help just handling EMS staff. And so we don't really see a gain in trying to outsource any of our vehicles elsewhere. And I think we could pay by building our stuff in-house and keeping it in-house. I think we can pay a significant amount of this position. The other one we have is for the fire training officer. Lost my slide. There it is. The rationale is this position will coordinate the recruit training, the department-wide fire training, and emergency training, as well as coordinate liaison with Wichita and the other Derby and the other fire departments in our areas. One of the things that we have really worked on since I've been chief is functionality between all of us and our neighbors to be consistent, and our training to be consistent, so that when we get on a scene, we're using common terminology, we're using common language and common training, so that therefore we operate together and understand each other on emergency scenes. This is a high priority for us. We have pulled Derby paid for a consultant, which is one thing better than having a consultant when your neighbor pays for it. But anyway, Derby's consultant comes back and tells them they need to have a full-time training officer for a 27-person department. And we have 150 person department and we don't have a full-time fire training officer in an FTE. So we also have gone around and researched. We did nationwide for departments with about 150 personnel. And 37.5% of those had one fire training officer, 31.25% had two fire training officers, and 31.25 had 3 to 6 fire training officers. When you look around the state, when you talk about the ratio of trainers to firefighters, Hutchinson is 1 to 30. Kansas City, Kansas is 1 to 40. Wichita PD is 1 to 43. Wichita Fire is 1 to 47. Topeka is 1 to 49. EMS is 1 to 49. Lawrence is 1 to 50. Lawrence Fire EMS. Sheriff's Department's 1 to 69. Salina is 1 to 91. And we are 1 to 154.
Chief, quick question.
Yeah.
You're wearing me down every year. Okay. Can you get by with a lieutenant instead of a captain?
It'd be a start.
All right, that's my only question.
But I think one of the problems we have, sir, is when you have captains, I mean, when we started this, we really wanted it to be a division chief. Because when they are evaluating captains and fire crews, it's hard for a lieutenant to evaluate captains and hold merit. So that's one of the things where we have the issue with if downgrading it from a captain to a lieutenant, because we really wanted it to be a division or battalion chief. That way they have some authority over captains to tell them how to do their training and whatnot. But at least if it's captain to captain, there's still some, we can give them some informal authority. But one of our concerns is one of the best things that we've come up with when we do these drills is if one guy evaluates 27 fire crews, it's one perfect across the board evaluation. It's not when we use division chiefs to do this on their shifts, the crews that they like do great. The crews that don't like stink. That's what we get back. But when we use one person to evaluate all 3 shifts, 27 crews, we get back a consistent feedback. What works, what doesn't, what crews need help, what crews don't do great. And so that's where my concern is if we drop it below a captain is that you're going to have lieutenants basically evaluating captains.
For the last 4 years, so I've been fighting against this. And you, as I said, you've been wearing me down, but it's important.
That's good. Chief, if I may add to that, and what I'm hoping that we can do here as a unit and as with colleagues is really have this conversation about this need. I see this as a major priority for a lot of reasons. One of the reasons you've kind of hit upon is the consistency in language, the consistency in terminology, but particularly in public safety. I think this is a crucial need. I read that EMS did something similar with a training supervisor here a few years ago. I think it was, my hunch is that it's worked out really well. And I think, again, particularly with public safety and those that are front facing, I think the county's done a good job in other areas of seeing a need and making adjustments. We did it with EMS. I think the CJ Lofton Task Force and some of the lessons we learned with CJ Lofton, we saw the need for training and why this is important. And I just think that we've also got to shore up your department too. So I think the details we can work through and have a deeper conversation. I mean, it sounds like my colleague in District 3, he's wearing down on this thing. So I think we're making progress, but Chief, I see this as a big need and I think you need it for your department. I want to continue this conversation outside of this setting.
Well, and going along with that, one of the things we had an issue last fall with a recruit, and when we teach our recruit academies, we're pulling firefighters and lieutenants out of stations to teach the recruit training. And when you have a problem, the first thing is what's your professional standards of your trainer, and we get caught up and, it's like, well, he was a lieutenant on the floor. Well, this case, and we drug him in here and just gave him this assignment temporarily. And so we deal with if something occurs bad in our training or in our personnel management, then we get questioned about our professional standards and what qualifications that guy has to be a trainer. And that was a kind of a punch in my gut. It was like, Chief, what qualifications does that guy have? And well, not that great.
I think it's a great point for evaluation and accountability standards. I think this is something that we've got to take a real hard look at and see if we can't push it through.
And that, because Commissioner, I forgot to tell you the cost. We think like I said, we think the fleet mechanic will offset a lot of their costs with in building and the overtime savings, and then we have the training officer costs. So, and all these are projected for us to not have a budget increase to take them on in our budget.
I just have one question. Like with 1,000 hours of overtime, you know how much that costs?
I'd have to look at their pay.
Okay, I was just curious.
I mean, we can pull that.
Okay, thank you.
Some of that's going to be inherent because when they get called out at midnight, there's some of that we're not going to get away from, but some of it we can.
Any other questions?
Oh, last page, that's a decision Thursday discussion.
I think we've had a discussion, so covered that slide. All right. Thanks, Chief.
Let's stick around and see if the chief was going to talk bad about EMS.
Okay.
You ready, Chairman?
Yeah. Okay. And Commissioner Dennis is traveling. He may be zooming in, but he said to spot on.
Go ahead, proceed. Okay. Okay, next up is Regional Forensic Science Center on page 366. Unfortunately, Dr. Shelley Stedman could not be with us today. She had a previous engagement commitment that she needed to proceed with, and so I'm going to cover the material. I do have subject matter experts in the room should you have questions that are beyond my capability. Katie Asbury, the forensic administrator, is in the back of the room. Sherry Beck, the chief medical investigator, is also in the back. And then Lana Goodson, our criminalistic lab manager, is present as well. So if questions arise. And I won't do this the justice that Dr. Stedman would, but I'll give it a shot. So staffing wise, the Forensic Science Center is not too bad. They currently are awaiting the arrival of a pathologist who will start in July. And that will give us 3 doctors back on staff. Currently, the 2 doctors have been very busy. They've reduced some of the number of autopsies by not taking some of the out of county in the absence of the 3rd doctor. And then Dr. Stedman also arranged for a contract with pathologists out of Johnson County to come in on weekends as she had availability and take some cases to relieve the other 2 physicians. But we'll have a new doctor on staff in July. And then in the forensics lab, I think we have, if I understand, I think we have scientists hired or en route, about to be on staff. So they should be staffed again here fairly soon in the next 3 months, but then they have a training phase that they have to go through. It takes a little while to get them trained based on their level of experience. And during that time frame, in-lab scientists are doing less casework because they are providing training to the new hires, and leads to sometimes to increased backlogs as they try to get people trained. So she hates to lose them because it's not good for business. So she's trying to hang on to them. Strategic goals for the Science Center include employee retention, advancement, and job satisfaction, her number 1. That includes compensation. The biggest challenge I think she's had has been compensation, as she gets employees who are long-term who top out in their range and don't see pay increases. That's hard for those folks to get compressed, and then being able to compete with other labs in the region with competitive wages for folks coming in at the entry levels is something that's on her radar. Number 2, expansion of the physical space. Obviously, we have a CIP that's slated for this year, and we are in the early phases of that. Facilities is working that project, and I talked to Andrew about it last week. Acquisition and implementation of LIMS, which is the records management system for the lab. Historically, they were working out of Access and SQL databases, not the best solution. They've been working for a couple of years, seems like a couple of years now, on implementation of their LIMS. I think things are improving with that. I know there's some, like any new software, there were some hiccups at the front end and some things to work through, but I think that that's coming along. Strategic goal number 4 was equipment replacement program. Historically, Dr. Rorig, the former director for many years, utilized grants, and we continue to do that. Dr. Stedman spends a lot of time, she and Katie spend a lot of time on grants, writing the necessary paperwork and the necessary reports to help fund some of the equipment and other needs at the Science Center. But a long-term strategy includes hopefully the new equipment reserve funds that we'll have available to us. And last year they were able to take some of the savings at the end of the year and carry that over into this year to help with that. And I think that's a long-term strategy that Dr. Stedman would like to hopefully be able to employ in the future for some of this high-dollar equipment. And on this slide, she notes some of the costs of those pieces of equipment. They're very high. Instrumentation is very high cost. Goal number 5, training and continuity of services. She wants to ensure that her staff is grow your own to some degree, make sure that they get the training they need to continue to advance their education and their skill levels, and to maintain continuity of services over time. 5-year horizon. She wants to be able to recruit, again, competitive wages and work environment, lab space that is adequate for the staff, that helps recruit and retain both scientists and physicians. I know that she's projecting that if the rate of deaths continue to increase, we've had increase in deaths since the beginning of the pandemic. I assume community health is not as good as it used to be, or aging, baby boomers are aging out. But regardless, there could be a time in the near future where we would perhaps need to add a 4th physician to the corners, to the district coroner. Of course, with the out-of-county cases that they take, those usually pay for themselves. That's how the 3rd doctor kind of historically was paid for, was revenues from those outside cases. And then, of course, carrying cases internally. Address limitations moving forward with CIP. We have the pending CIP, and that will help alleviate some of the issues in the existing building whenever they're able to remodel and reconfigure to help the scientists in that main building with their workspace. Addressed increased staffing needs in accordance with recommended standards, sufficient to address the increase in the number of deaths, 20%, number of autopsies, required 28%, the number of scene investigations by 35%. And that number will speak to the one decision package that she has submitted. Identify funding to replace critical instrumentation, which was mentioned in one of our strategic goals. Identify funding for increased cost of maintenance agreements. Again, I think that would be part of the equipment replacement goal, perhaps. And then consider technology enhancements to ensure state-of-the-art equipment is available for testing procedures, to include a KTOF and the LODOX. She's talked about the LODOX, which is a full body X-ray scan that would allow the physicians to be more efficient whenever they have those trauma cases, or whenever they have bodies come in that they need to determine if there's projectiles inside the body. Right now, the old X-ray system is not very efficient, or takes a lot of time to get it done. So she's looking to the future to be able to fund some more advanced technology to get things more efficient there. And that gets us to budget. Her budget, primary, let's see, contractuals. The reductions in contractuals is due to some one-time funding that was received from the rainy day reserve fund for 2023. So that money is backed out. Some decreases in revenues and expenditures due to one-time grant funding received in 2023. So really the changes in numbers there relate to grants and some one-time funding that was provided in 2023. I think the 315 was for the one that was the opioid money or whatever source we used there. Okay. So really her budget is pretty normal. There's nothing unusual here. That takes us to the decision package. Dr. Stedman is asking for one full-time medical examiner to supplement her current staff, which includes a chief investigator, which is the boss, the supervisor of that group, and 5 medical investigators. These medical investigators cover 24 hours a day, 7 days a week, 365 days a year. As stated earlier, there's been an increase over the past 3 years in the number of death cases, which then increased the number of necessary autopsies that need to be done. These folks are the field investigators, the CSIs, if you will, for the coroner. They are the ones who collect the necessary materials and evidence that is specifically necessary to the coroner. And they're the ones who inform the coroner whenever there's questions about the situation of the body, the evidence, the narcotics, the drugs, whatever was collected.
Rusty, question on that, if you don't mind. Is this in addition to the temporary medical investigator, or would that temporary position turn into this FTE or?
So, yeah, that's a good question. Thank you for the question. So this year we gave Dr. Stedman one full-time temporary FTE for a couple of reasons. She had one medical investigator who was going to be on long-term leave. She had another who resigned and went out of state. So she was down to essentially 3 investigators and the supervisor. She was trying to fill the one vacancy, and she was able to do that. And she simultaneously, she had a second applicant. And with the caseload they were carrying and with the long-term out, we gave her a temporary full-time to kind of cover that employee who was going to be out for long-term. That position will go away. And or convert, if you authorize this position, then she will have 6 investigators and 1 supervisor. This temporary will go away at that point. It's good for 1 year, unless it's extended because she has a need. But what she's hoping to do is just make that a permanent position.
Thank you.
And the other thing I would say about this is this has been an ask over the years. There was one point where I think they had 4 and then had a temporary part-time. And then they finally got up to 5. Again, the caseload continues to grow. These folks, not unlike firefighters or paramedics or police officers or dispatchers, are exposed. Number one, they're working 24 hours. They're working shifts. I think some of them are, I think right now you're on 12-hour shifts. 24s. Okay. Still working 24s. Part of that time is in the office. Part of that time, I guess, is on call. But essentially they're going into situations where they're exposed to folks who are deceased. They're doing crime scene investigation for all intents and purposes. They're exposed to grieving families, decomposing bodies, all the trauma that all of our other first responders experience. They're the second responders, but they're exposed to the same stuff. And sometimes they're there in the house with the family, trying to manage family. And then after the fact, they're managing family who has questions about what's going on with the autopsy or release of the body. So these folks are doing the same type of work and exposed to the same type of trauma, and really honestly working 7 days a week, 365 days a year. They really should have, if you take a staffing model for EMS or fire, they should really have a little over 5 FTEs. They should have close to 6 FTEs to cover that 7 days a week, 365 days a year, in order to have some overlap, in order to have some coverage whenever they're sick, vacation, holidays, et cetera. So I think this is reasonable. I support Shelley's request. Obviously, it's your decision to make the policy on this, but that's where we are with that. That's her one request. She had a couple of others, but she's found options for taking care of those outside of budget, either through grants or otherwise. So with that, we had the one decision package for 84,432 for one investigator. If you have any questions, I'll try to answer them, and or I'll defer to the experts in the back of the room.
Questions, comments? Rusty, this is my personal thought, but maybe for our consideration as a commission. Her role, this department's role in this, I'm associating this department as one of the key maybe recipients of our opioid settlement world. I mean, I'm sure EMS and there's some other components, but and I'm not sure that it's a personnel funding opportunity as much as I think when that equipment or whatever we can do to help, from my perspective, to help build her and that operation up to help satisfy the court system and the families, the delays on autopsies, all those things. And if we do have this outside opioid funding that's intended to help solve some of this stuff, it's just my personal feeling. I don't have any solutions, but and obviously a commission driven comment and from my perspective. So anyway, that's not solving this one, right? Just saying as we go forward, because I'm really glad we funded that one equipment purchase.
That was very much needed and very appreciated by Dr. Stedman and her staff. And I agree with your comment that within reason, we have to be reasonable in what we do, but at the same time, we are providing a customer service. We're providing a vital service to the criminal justice system and to the population in general when it comes to deaths and autopsies and getting bodies released for families. So it's critical service. It's kind of out of the way and they don't get much attention because
I know
they don't speak for themselves because they're serving others, but appreciate all the support that the commission does extend to Dr. Stedman and her staff. So, anything else?
Questions, comments?
All right.
Okay. Thanks, Rusty.
Thank you folks for coming. If I misspoke, you can send me an email. And we will now move to corrections. Chris Morales will present since Steve decided that he needed to go on vacation. He'll probably do a better job than Steve. Just kidding.
Good afternoon. It's a pleasure to be here this afternoon to present corrections annual request on behalf of Director Stonehouse. We will start with our workforce strength, and I assure you this is not as bad as it looks. I was actually encouraged when I looked up last year's and remember standing at the courthouse and the commission room saying we were at 66% overall. We were in a much worse crisis situation last year and had 11 boxes that were in red. So we feel very thankful and fortunate that we're getting staff hired. Also, on behalf of corrections, I would like to particularly thank the commission for the increase in pay for our corrections officers and our intensive supervision officer positions. Those are the two largest job families in corrections, and you approved pay increases for both of those that were a little bit over $6 for each of those positions. So that has helped us tremendously, not just recruiting, but also retaining those folks. This has been a very exciting last week or so for us. As you know, a few days ago, we opened juvenile residential facility. We're very excited that is up and operational again. Hopefully we'll see as many youth as we had before. Right now we're at 7. So although that box is purple on our workforce strength, it's because we're staffing it for the 7 kids that we have there. So really we're doing just fine. I would turn that box green if I could, because that's where we need to be right now. And then I also want to point out, Rusty kind of alluded to this earlier, that we are holding some positions vacant intentionally. For example, we have a new medical provider that is providing mental health services. We used to provide mental health services in-house. So we're holding those positions vacant. And then cooks, where we have an operational kitchen and juvenile detention facility, and those were very hard to fill position. And so we are currently in an RFP process to outsource that. And so we're holding those positions vacant as well. We also did a thorough look through every single position this year with our senior management team, grant and general fund, and we're able to reduce 8.5 positions on both sides. So we felt very fortunate with that.
You mind if I ask a question on that? Which department did you say you were doing some outsourcing in?
It would be juvenile detention facility. We are looking to outsource the kitchen.
Oh, kitchen.
Meal service for juvenile detention and juvenile residential.
Has there ever, and I know we're late, so we can talk about this another time. I see JRFs at 42%. I know we've had problem staffing. Has there ever been a conversation about what it looks like to outsource or public partnerships, private partnerships with JRF and some of the community organizations that we have? Has that ever been a topic of conversation with JRF?
I don't remember that myself for JRF. We have talked about privatizing years ago, juvenile detention.
Okay.
Juvenile residential, I will just point out, is a much less costly alternative to detention. Detention costs way more.
Sure.
And so it's nice to have that alternative at a lower cost to the community.
Yeah, I just know that we're having staffing problems there and had this thing shut down for a bit of time. So I'm just curious if that was ever part of the discussion with JRF, and not a discussion for today. I just something we can discuss in the future.
That includes some of the, I don't know if there's any legalities that would be, I mean, that's-
With JRF.
Chris, who would you outsource that to? I mean, who in the community provides that type of supervised?
That's a good question. I think any social service type provider, but they would have to be licensed.
Yeah, I don't know if they exist right now, which, well, I mean, that's not outsourcing it to Uncle Bob. We're talking about doing this at some. I just think if we're having serious, JRF, in my opinion, is an incredible program that serves an incredible need. And if we can't staff it, I think that we should look at alternatives, opportunities to link into the community. And that is just, it's a high level thought that I think that if we continue to have staffing problems there, that I think we should open the discussion for some opportunities, but not a discussion for today. And I probably shouldn't even have brought it up, but.
Well, can I jump in real quick, Chris? I think it's actually very timely because one of the things you're going to hear about in your CIP presentation tomorrow is a roughly $22 million project to do a juvenile community-based services building. And that's something we're actually going to propose to start working on in 2024. So I think it is actually probably a timely conversation because that's a big price tag to pull the trigger on if there's going to be some alternatives considered.
Okay, all right. It was timely. See?
Okay, so why we're in business is to reduce recidivism, change behavior of our offenders. So what this chart shows you is how many reoffend after 1 year of successfully completing our programs. And honestly, I think this looks really good for working with high-risk offenders in our community. And again, keeping them in programs in the community and out of jail and prison. We also, part of our strategic plan, we're very interested in making sure that our workforce looks like our community. And so we keep some statistics on those that we are hiring. And in 2020, that we chose to go with 2020 because that was the most recent, I guess, normal year for us for hiring. We were at 37% of our workforce was minority. And I checked back to January of 2023 and we were at 37% too. So we feel very proud of that. I will just mention that we are working with WSU on the creation of a 5-year strategic plan. So I think we'll have even better strategic plan measures to bring to you next year. Opportunities, everyone has mentioned this as challenges and opportunities, a challenge being staffing, although we've much improved, we still have some work to do. But the opportunity there is we do have a full-time recruiter that works for corrections and she's out all over the place. You probably see her a lot on social media and she's really helping us to get folks in the door. Competitive wages and raising those for the ISOs and corrections officers it's been a tremendous opportunity. We also have an opportunity on the horizon for some robust training. We have the University of North Carolina, I think is coming next week, I believe, and they're going to be working with us on some new evidence-based practices, it's really a paradigm shift to a coaching model for offenders. So we're very excited. They invited us to be part of this and we feel fortunate for that. We also have an opportunity for continuous quality improvement and professional development with existing staff. And we learned a lot with the Lofton Task Force, and we're going to really focus in on safety training, evidence-based practice training, and how we can do better in that realm. So our CQI team is almost ready to start, and we've done that with existing staff. And why that's such a great opportunity is that will inform our training and where we need to improve on. And then the last thing I have is just office space. As Lindsay mentioned, we have CIP request and we are busting at the seams. So we left some of our leased space at 3803 East Harry, moved some adult programs into existing space, but the adult services has no more room for program expansion. The one thing I want to mention about JRF is our evening report center moved into that space. We did give up 7 beds, so our evening report center is there. So depending on what happens with JRF, we just have to keep that in mind too for space needs. Okay, so our budget request is here, $29,327,021. On contractuals, the one thing I want to highlight, again, we have a new medical contractor, but they provide more services to us. They provide mental health services. They also provide additional hours of medical service within their staff. And then, of course, the outsource of food service. We have 2 decision packages. The first one is related to Veterans Treatment Court. Again, this has just been an exciting time for corrections, and we thank you for allowing us to be part of that partnership. We're really beyond excited to get that program going and be good partners in that. With that grant funding, corrections gets a part-time specialty court administrator, and that person will be in charge of the Veterans Treatment Court. They will also be in charge of drug court. So there is a companion alternative reduction package that goes along with this. We're suggesting that you fund the part-time or 0.5 FTE of the specialty court administrator, and then eliminate the drug court program manager position, who is currently running drug court. But this particular position would be an administrator position and would run all specialty courts, those that we have now, and then those that may come in the future. Our next decision package is office specialists. We have 2 temporary part-time office specialists that are currently filled, and we are requesting that we turn those into permanent part-time positions. On any given day, we have about 1/3 of our support staff positions vacant, which makes it very hard when we have the reception duties and we see clients all day long on both juvenile and adult side. During 2022 and 23, when we were probably at our lowest, probably 50% with support staff, we used a contractor to hire those hard to fill positions. And while that worked in a pinch, the annual spend for this service is significant. And the annual cost to buy out someone out, their contract is also very significant. So we feel like this, like I said, both positions are currently filled, and we feel like this would be less costly than contracted labor. The alternative reduction is what I mentioned before. This would be eliminating 1 FTE, the drug court manager position. So this is what it looks like as far as our decision packages, to add 1.5 FTE, but eliminate 1 FTE. Corrections also administers the Crime Prevention Fund, and these are the programs. We have 5 programs and a contingency fund. These are the programs that are currently funded along with the dollar amounts. I just want to mention that the administrative contingency, this is not personnel. This is a contingency set of money that hasn't been allocated for WSU to provide consultation services, which is very much appreciated for evaluating these programs and reporting back to you. And it's also education opportunities for Team Justice, your Juvenile Corrections Advisory Board. Challenges here, we're on different funding cycles with these programs. We are transitioning at the end of this year to a multi-year funding cycle. This is a request for proposal process. The opportunities here is Dr. Craig with WSU, who's our evaluator for this program, has got our programs on board with risk needs responsivity, which is a approach that is going to promote crime prevention at much better rate. And Team Justice provides oversight over the service gaps. So we feel like we have a good oversight program in place for that. There's no change to the funding request. This is 582, 383. And again, there's no FTE tied to that. Any questions?
Well, that's depressing than most students.
I know, this has been a fun one. This has been a fun one. Thank you so much.
Thank you.
All right.
Last but not least, the building department is here and Chris is going to be brief.
Yes, well, I can always say we'll be cheap and easy. Are there any questions?
That's cheating.
Right, maybe not quite that brief. So on the org chart, I'll start with the purple. We are rearranging some job descriptions with those. So we delayed that a little bit. I'm not concerned about that area. That's just natural attrition. Also with neighborhood, those are city positions, same kind of natural transition, and those are in the process of being filled. Overall, obviously, we're very healthy. Manning wise, I am concerned about the plan review, the yellow you see on building. We had 2 retirements last year. We filled one of those positions with a minimally qualified internal hire. We have not had any interest in the position that is still open, and I have 2 more retirements scheduled for 24. So just the way the industry is right now, that's a very technical position with a lot of qualifications. So we have a growing concern there. We've adjusted the job description a little bit, which we hope helps. But that may be something we hear more about. Our mission is to, of course, keep the community healthy and safe and growing through code. We split that out to a vision that will do that with cutting edge, keep us on the cutting edge, be fair to everyone, and have good customer service. Our goals are designed to reflect accomplishing that, as well as supporting the county strategic plan and the city and county programs that we're charged to oversee, in addition to just the baseline building code. A few things on our horizon, as stated, moderate employee turnover overall, that seems manageable. A little bit of a growing concern with the way the industry is now in not seeing a lot of applicants for our positions, but mainly just that plan review area as a concern. Also still working some staffing table, just kind of make it better type things we would like to do that I think will assist with that, just kind of help in the way we manage our positions and the work. One thing that we will need to look at, both of our software providers are more rapidly than originally forecast moving to a cloud-based system. We will just not be supportable to do those on our own servers for much longer. So we will have to make an adjustment there, which is likely to include that we'll at a minimum put out an RFI to see who else out there may even better meet overall needs. We do, thanks to Lindsay and the finance team for getting our fund approval there. So we will have a separate revenue fund soon, which will, thanks Commissioner Howell, especially for the work you did at Topeka to help with that as well and to advance that. So that will make this even easier in the future. And then also will hopefully let us not see some of the changes in budget when we replace technology and equipment. You'll be seeing us in 24 a fair amount, as we'll do a full code cycle review and adoption with the 24 codes. And then you'll see a little bit more as we go. You'll see what I'm talking about with some of our commercial activity, some increases in commercial activity on my decision package. Very minimal change to the budget. The balance you see there in commodities and contractuals, we have a pretty low commodities budget, and we did a tech refresh this year. So that puts an extra $125,000 in the budget that we also all spent in January. So that's merely what that is. And again, some of that fund, I think, will help us balance that as we go forward in the future. And so overall, a slight reduction based on the fact that just personnel, we've had a fair amount of excess on our personnel budget the last few years. We've also had a few retirements of higher level salaries. So that's the reason for that minimal change. Our first decision package is based on some increased needs in the community for commercial property management, existing properties, especially those that are aging, that are vacant. Last year, or this current year's budget, we added 2 part-time inspector positions. And a lot of that was designed to help us manage these kind of situations, to manage our cases. We would like to add $75,000 of
funding that we could use to address those properties in extreme situations. That's obviously not a lot of money when it comes to a commercial property. But if we were in a situation where we needed to abate a hazardous condition on a property, there have been a few cases of small properties, a small restaurant. We've had actually 2 bars that burned, and they were completely burned. We used the residential condemnation budget to do an emergency removal of those. So that obviously puts a strain on that budget, which is already very strained. So this would give us a little bit of money for that if we need to board, if we need to fence. Now, the caveat with that is when we do that, we do assess it back to the property owner's taxes. So this money theoretically and eventually will return to the county budget through that process. But again, that would give us a little bit of money to do that during a year, and then evaluate where that 75 got us and what else we might need. The reduction package we have is one of actually our land use positions. So our nuisance inspector is funded by solid waste tax through environmental resources. This position was utilized in the transition for MABCD. It bounced around a little bit. It actually has not been filled for about the last 3 years. But we were waiting to ensure environmental resources knew what they wanted to do with the position and the money. So they're at the point that they want to just capture their portion of this for savings with expansion of their programs. And so we're ready to go ahead and officially take that off the books. And 70% of that, 71% of that will be MABCD savings. And so our nuisance inspector, Caesar, who most of you know, since we send him complaints quite often, his position is now 100% funded by environmental resources. So that is a shift in these and this gives that portion back. So the breakdown of those there. And questions if we have any
questions. Chris, thanks for please share my appreciation and maybe others of everything that your 75-person staff does, and very responsive, and I appreciate that. Lots of times you get stuff thrown on your plate that you didn't expect, and they've always been very responsive and respectful and communicative. So my personal thanks to you and the staff.
Just one question, one comment. So on Caesar, how much of his salary is county side, city side? And
it is all county, and it's all from environmental resources. So Caesar works solely on county zoning, nuisance, land use code.
Explains why he always answers the phone.
Yes.
It'd be nice. I don't know if this is the right time to do this, but it seems like, in your total budget here, it'd be nice to have that broken down by fund source. This is one of those budgets where there's a lot of fee fund involved in this. Was that?
All general fund. Are you talking about the revenues? How the revenue?
He has revenue to offset the expenditures. And so what's the offset that may go to general tax versus fee fund?
So yeah, Commissioner, what you saw presented there is 100% revenue funded.
Okay.
So we do, this includes that on the city portion of our budget. So city portion of our budget puts like $2.2 million. It funds 2/3 of the neighborhood inspection program. And that is then the rest of that, or anything above that, is city general fund. But everything here is revenue based, or and then the one position funded by environmental resources.
It makes things a little bit easier because it's not property tax.
Yes, sir. So no tax now in my effort to be brief, I actually did skip the parts. So the industry is growing. Last year was a record year, especially for commercial development, record year for plans. We actually jumped in 21. We did 113,000 inspections. Last year, we did 143,000 inspections. So we had 812 commercial projects come in. So our revenue, I want to be careful how much I say this out loud and publicly, but our revenue exceeded our budget by $1 million last year.
Well, and you can say you don't want to say that loud, but it's right here in the budget.
Yeah. And we are still discounting. So all building permits are discounted by 10%. That's building only, not the trades, but that also means the plan review is discounted by 10%. And then the city infill program that is in place right now means that in the formative areas of the established central area here in the city, we waive all MABCD fees. So we began that in October of last year. From that point until now, we just passed $100,000 in fee waiver. So not a large amount. I also skipped over the fact that I presented this same basic layout to the Wichita Area Builders Association Industry Board, as well as their Codes and Standards Committee. So they have approved, have their concurrence with everything that we have included here.
That's good. Thank you. Okay, Chris, I don't think we have anything. Thank you. Let's keep that.
That close it out. All the summary slides.
Slides.
You're gonna talk really fast.
And that concludes the presentation essentially. Just to recap, the Public Safety Division budget request is 102 million. The minus 4.29% is largely from EMS, from the transfer of their fund balance, the last payment for their administrative fees having been a separate fund. And that's really the bulk of that decrease for the most part. I've got some other notes on it, but that's really the gist of it. And then to recap Laura's presentation, 3.8 million in requests. EMS had $1,033,000. Fire had 201,934. A medical investigator from Shelley. And then corrections had 111, but they're offsetting that with a $93,000 decrease, getting rid of the drug court administrator and replacing that with a specialty court administrator that's half paid from the grant, at least for the first, is that a 5-year grant, 3-year grant? And the other half paid by general fund for that time period. And then Chris has the request for the money for the nuisance abatements, commercial nuisance abatements. And then he's getting rid of a position that hasn't been filled for 3 years. Sorry. Total decision packages were 5.3, total reduction packages were 162,000, and there were no revenue packages. That is it, unless you have other questions or comments.
I just, just the only comment I'd have again, thank you, Lindsay, for showing me the number on the page. It was helpful. But in this summary, it might be nice to have that broken down, say, by fund source on those requests, or I should say the decision packages. How much of the decision packages are property tax funded? I don't know how we can do that.
He has all of that. So
Okay.
we can provide that.
Well, at some point, maybe not today, but it's kind of late, but that'd be great to have that. Thank you.
Print it out for you tomorrow.
Thank you.
I was going to make note in there, but it's on the first page of the Public Safety Division. It shows you what split is tax funded and which is non-tax funded.
Not for decision packages.
It's not for decision packages, but for overall. So that's there. All right. Thank you very much for your
Thanks,
time.
Rusty.
Glad we can keep it within 4 hours.
Yeah, next year we're getting you more than 2.
So
Whether you need it or not.
other than the county appraiser presentation tomorrow and the CIP, have we seen everything that we need to see as a commission for consideration on next year's budget?
Yes.
Okay.
But we still need to have a conversation about exploration places, 7 million. That did not come up as a decision package.
Yeah, but would
That's
that
the
be
only
a-
thing I'm aware of you have not seen in this setting.
And we're coming to you on that.
Okay, for our. Okay. What else we got?
Voila.
Okay, then we are back on at 1 o'clock tomorrow.
I'll
Okay.
need a sugar.
Thanks, everybody.